Why I have to shout like this? I'm surprised. Honorable members, as we have indicated, we are starting our work. But before we start our work, we would want to start with a prayer. Honorable members, before we start, can we please have a moment of silence, of a silent prayer or meditation? Thank you very much. Thank you very much, honorable members. We want to go through the rules so that all of us are together. Honorable members, this is a budget debate of the legislature that we are conducting through the hybrid means. You are reminded that this budget debate will be concluded in terms of the standing rules of this House. Our standing rules, honorable members, also define present as follows. Present means the attendance of a member in a virtual meeting by electronic means in a manner that allows the member to join and participate in the meeting. The standing rules further provide that a majority of members of a committee constitute a quorum. The table staff have confirmed to me that we have the required number of honorable members present in order to commence with this session. The meeting is therefore properly constituted and may formally continue. We want to clear the issues of connectivity. Honorable members, before we proceed with the budget debate, I must reiterate the ruling of the Speaker relating to addressing connectivity problems. The Speaker has ruled that the following measures will be adopted to try and assist members who may not be able to participate due to connectivity issues. 1, if a member has connectivity problems, the presiding officer, in this case myself, will continue with other speakers on the speakers list for the debate. If the member regains connectivity before the response to the debate has commenced, the presiding officer will be flexible in applying the speakers list, and the honorable member will be allowed to continue and finalize his or her speech. Secondly, we also ask members who are debating to allocate a fellow party member who will be able to take over the member speech and read the member speech into the record. The presiding officer will then allow the fellow party member to take over the member speech. Thirdly, if all else fails and the member is unable to present his or her speech or to get to another party member or a whip of his or her party to take over, it will unfortunately not form part of the official record of the proceedings. If a member does have connectivity problems, we will follow the above guidance to try and assist members. I hope that this is in order, honorable members. Honorable members not debating are reminding at all times to mute their microphones and switch off their cameras. Also, honorable members are requested to take care of any noise in the background that interferes with the broadcast of the proceedings. Honorable members, I further wish to confirm that the budget report of 2023-2024 of the Health Portfolio Committee has been tabled in terms of the virtual rules. We will now proceed with the matters on the agenda, being the debate on vote number 7, which is the Department of Health of KwaZulu-Natal. I therefore humbly invite the Honorable MEC for Health, Honorable Smelane, to take the podium and present her speech. Makucho.
Thank you very much, Chairperson Malume Wengane. Honorable Nkosi. Honorable Speaker, Chairperson, I wish to greet the Speaker of KwaZulu-Natal, Honorable Nontembeko Boyce, who is with us today, and the Deputy Speaker, Sibingelele Premier of KwaZulu-Natal in absentia, Leader of Government Business, Honorable Siboniso Duma, Chairperson of the Health Portfolio Committee, Umama Unomakiki Majola, members of the Legislature, Chairperson of the House of Traditional Leaders, Inkosi Ushinga, abantwana basendlunkulu in our midst, mayors, councillors, amakhosi, Chairperson and members of the Provincial AIDS Council, Head of Department of Health, Dr. Sandile Shabalala, and his team, Department Senior Management, Leadership of Organized Labor, Leadership yasemzala Nxumalo Region, lapho engivela khona, healthcare workers across the length and breadth of the province, esteemed citizens of KwaZulu-Natal, and those watching these proceedings online, distinguished guests, members of the media, ladies and gentlemen. Chairperson, 3 years ago, we stood in this august house during one of the most turbulent and difficult periods throughout the globe and in our own nation's history. This was a time when we were forced to confront the wild, ugly, and deadly monster that was COVID-19 pandemic. We were all anxious and fearful. We did not know what the future held, and we did not know whether our loved ones would make it to the other side. And indeed, sadly, the pandemic went on to claim the lives of thousands of our loved ones, causing much pain and anguish. It is now a matter of the history books that our healthcare workers played a critical role in saving lives while putting their own lives on the line during this extremely difficult period. They did the same when they encountered the looting and destruction to property in July 2021, and they also rose to the occasion when our province experienced severe flooding in April last year. In the end, their dedication and hard work made all the difference. Siyabonga kakhulu ukubona. And it is therefore fitting that we should again begin this address by paying tribute to them. It is also fitting that we should take our hats off to the 426 heroines and heroes who lost their lives while working on the front line of this battle as healthcare professionals in this province. City Asisoze Sabakol. We are not just harping on about COVID-19, but as the lead department responsible for health, the impact of this pandemic has had profoundly deep impact on our core business, and this impact will continue to be felt in many years to come. We also want to take this opportunity to recognize and thank all the nurses, doctors, allied healthcare workers, and support staff at all levels who continue to be the backbone of this department. The care, hope, and healing that you give to the sick and injured, to the desperate and hopeless, and to the relatives drowning in the pits of despair is indeed invaluable. Thank you for being our leading lights. We know and appreciate the scientific miracles that you perform each and every day, and so do the people of KwaZulu-Natal. And as can be seen from the sentiments expressed by Ms. Matom Kize, who wrote to us and said, ngidlulisa ukubonga kwiklinikhi yaseNanda, okuyinanda CHC, bangithethisa kahle umntwana wami ngomhla ka-11 November 2022. Inkosi babusise, angive ngiphatheke kahle. Sengilikhohliwe igama likanesi, kodwa ngiyabonga and ngiyafisa ukuthi bakwenze nakwabanye. Kuyasho-ke sihlalo ukuthi onesi bethu bayakwazi ukusebenza baphathe kahle abantu. So we thank the Lord Almighty for manifesting his infinite wisdom and greatness through your healing hands. Siyabonga kakhulu. We are also acutely aware of the emotional turmoil and many of our health workers suffer when they lose their patients or when they get exposed to horrific and traumatic scenes during the course of their duties. That is why we have taken a very bold and decisive action and established established an employee wellness program that is made up of occupational health as well as psychosocial stream through our chaplaincy program. They are the nurses or the health workers, they get to decide, chairperson, whether they want to go to a psychologist or they want to go to a religious leader, so that they are then counseled in a manner that is convenient to them. Chairperson, at this point, I would like to give credit to Ingole Masondo-Sondo, umbutho owakhulula abantu noqhubekayo ukusebenzela abantu, i-African National Congress, for the resounding vote of confidence that it has shown to women in the province of KwaZulu-Natal. By appointing the first ever female premier in Comrade Nomusa Dube-Ncube, the ANC has indeed taken a giant leap and has taken society with it. It has not only affirmed its character as a non-sexist and non-racial unifier and leader of society, but it has also assured all girl children in every corner of this massive and beautiful province, including those from its most remote parts, that their dreams are valid, that their progress in life can never be limited by their gender, and that indeed, through hard work, only the sky is the limit. Ingane zethu zamantombazane siyafisa ukuthi zazi ukuthi bazingenza noma yini ezifisa ukuba yizona in future, and ukhongolose sokukhombisile lokho ukuthi umholi angakwazi ukuhola even at the highest level kahulumeni. Siyabonga kakhulu ku-African National Congress. Chairperson, we continue on our path of reclaiming the history of our leaders by renaming hospitals, buildings, and other public amenities after them. In this regard, one of the hospitals or some of the hospitals that we will be renaming is Nimeya Hospital, Esemadlangeni under Amajuba District, as well as Vryheid Hospital under Zululand. Kakhulukazi ngoba uNimeya no Vryheid uma ngabe sibona history yethu siyabona ukuthi baqhelelene kakhulu nehistory yabantu abamnyama. Kubalekile ke ukuthi abantu bendawo bazi ukuthi izibhedlela zabo zibizwa ngabantu ababaziyo nabantu abakwazi ukurelate nabo. Ngiyafisa ukusho, chairperson, ukuthi we are busy consulting with the leadership of both districts, leadership local, leadership yasemakhosini, so that we get guidance on ukuthi liphi igama esingalisebenzisa. Ngangisho ke sihlala ukuthi kungakuhle uma ngabe leadership ngelinye ilanga ingathi kuthina mhlawumbe uVryheid Hospital sigcine siubize nje ngomzala Nxumalo Hospital, kungayinto enhle kakhulu leyo. In just 8 days, our country will celebrate the 29th anniversary of Freedom Day on the 27th of April, which marks the maturing and coming of age of our democracy. This year's Freedom Day will take place in a province that is markedly different and better than before. I'm talking about KwaZulu-Natal, where rural communities have their own clinics, community health centers, and hospitals. KwaZulu-Natal, where patients enjoy basic human rights, where their skin color is no longer a barrier to gain access to hospitals with highly specialized care, unlike in the past. I'm talking about KwaZulu-Natal, where villages that once had no hope can today point to a local child who is now a doctor, an oncologist, a nurse, a physiotherapist, psychologist, speech therapist, and the list is endless. I'm talking about KwaZulu-Natal, whose government has the requisite experience, capacity, and political will to continue working hard to improve the lives of the people. I'm talking about KwaZulu-Natal that is ably led by the government of the African National Congress. I have no doubt that all of this is what our founding fathers envisaged when they drafted the Freedom Charter and agitated for a South Africa that has a preventative health scheme run by the state, free medical care, and hospitalization that is provided for all, with special care for mothers and children. Chairperson, I would like to assure the people of this province that we are serious when we say we will leave no one behind during our journey to improve ordinary lives of the people. This is why we are finalizing our plans for the construction of 9 brand new hospitals, 1 in every district, and 2 CHCs, which will be built in Umtubatuba and eThekwini. We will start building them in August. Asikhulume ke sihlalo la into esithi inzwa bethi iprocess isiqalile, all the work in terms of paperwork has been done. We are just waiting now ukuthi qala ama processes of procurement so that by August we hit the ground running. We will start building them in August, like I said. We believe there's a need for the establishment of a community health center to cater for the community of Mbumbulu and surrounding areas. Sihlalo abantu baseMbumbulu naleya ndawo sebekhale kakhulu ngesibhedlela. Unfortunately ngoba sikwazi ukwakha isibhedlela esiphelele sizokwakha i-CHC. Ngiyathemba ke ukuthi abahlonishwa abaqhamuke eThekwini bazoyijabulela kakhulu leyo. Sakha futhi i-CHC Ward 4 eMtubatuba municipality la ilapho sacela khona umeya wangaleso sikhathi ubaba uVarus Ngamphalala wathi abantu baseMtuba badinga isibhedlela ngoba sasingenayo imali namanje asikabi nayo imali yokwakha isibhedlela sayenza icommitment yokuthi sizokwakha iCHC iyona ke lesiyoyakha namhlanje. During this financial year, the department will also start the process of upgrading the Dumbe CHC into a district hospital, which will provide the people of Dumbe and surrounding areas with an improved level of care. We also want to assure the communities that have asked for clinics, we have heard their cries, we are working on it. As soon as we have the budget for it, we'll be able to implement. Ladies and gentlemen, all of these efforts are in addition to our bold plans to upgrade our 4 rural district hospitals that they offer a higher regional level package of services, including specialized care. Our plans to build a tertiary hospital in the north of the province are also gathering momentum. All of these infrastructural investments will ultimately ensure that our fellow compatriots who reside in far-flung areas of the province will no longer have to travel hundreds of kilometers and sleep far away from home just to see a medical specialist for 10 minutes, as it sometimes happens. Our overarching message in this regard is that everyone is entitled to easily accessible specialized care, regardless of who they are and where they come from. To those communities that still do not have clinics in their facilities, Sitimanga Pelamandla, Siyeza, Intuthuko Iyeza Nakubo. Chairperson, it is an indisputable fact that infrastructure investment, development, and maintenance are a vital part of the successful implementation of universal health coverage through NHI. As the province of KwaZulu-Natal, we pride ourselves for having obtained an overall score of 94% in infrastructure development for complying with the performance-based incentive system requirement. As a result of our sterling performance, we received an incentive grant from national government to the value of 78.2 million rand. Chairperson, the valleys and hills of this province have reverberated with great hope and optimism following our announcement 3 years ago that we intend to upgrade the package of services at the 4 rural hospitals, as I have indicated. These hospitals are Vryheid, Dundee, Bethesda, and Christ the King Hospital. Indeed, as a visionary and progressive government, we could not continue as though it is normal for people in rural areas to be deprived of these much-needed specialized healthcare services just because of their geographical location. Although our initial plans were disrupted by the emergence of COVID-19, we can stand before this august house today and report on the progress we've made on this project, which is as follows. We have now decided, after conducting a proper assessment on what needs to be done for us to be able to convert the district hospitals into regional hospitals. And we have agreed that Bethesda Hospital will now have beds that are 300 beds, moving from 200. Christ the King will move from 210 beds to 300 beds. Dundee Hospital will move from 204 to 270 beds. Vryheid Hospital will move from 338 to 540 beds. This, chairperson, will mean the people who come from rural districts will no longer have to move to other districts for them to be able to get the care that they need. Chairperson, on alternative energy sources, it is clear that the energy challenges that our country is faced with are going to be with us for some years to come, as indicated by the President. Despite the fact that the President announced that healthcare facilities should be exempted from load shedding, the reality that we face when we engage with ESCOM on the matter has been quite different, and they have been very difficult. We therefore have engaged the National Department of Health and the Presidency to assist us in this regard, although we have not sat down and folded our hands while silinde ukuthi sisizakale. Unfortunately, when power goes off, it affects not only hospitals and patients, but it also affects the investments that have been made in our health technology equipment. Therefore, we have decided to implement the various alternative energy sources in our different facilities. The options that we choose will be determined by the energy demand in that facility, as well as the rate of utilization and the size of the facility. In clinics that have not bought generators, we will also be sourcing inverters and solar panels. In hospitals, we will be using a hybrid system involving generators, inverters, and solar panels, depending on the need and what they will be used for. Chairperson, let me speak to Pixlika Isagase Memorial Hospital. This hospital has been operating now for more than a year, with various units being opened in a phased-in approach as reported in our previous budget speech. This regional level hospital has begun making a tangible difference in the lives of many people, especially those in the north of eThekwini, particularly in communities such as Inanda, Tuzuma, KwaMashu, Phoenix, and surrounding areas. Various units are already up and running at the hospital, including emergency medicine, surgery, and internal medicine, as well as specialized services such as the Benz unit, neonatal intensive care unit, and renal unit. We will be officially opening this hospital in October this year, and we will make the official announcement in this regard in due course. However, we are waiting for a date from the presidency chairperson, because the president will be opening this hospital on our behalf. Chairperson, despite severe financial constraints, we are doing our level best to comply, to employ those staffers who were contracted to help during the height of COVID-19 pandemic. We are now only left with 5,122 people who are yet to be fully employed, and we are moving from a number that is 14,000. We have nevertheless extended their employment contracts for a period of 12 months to allow for their eventual employment starting from the beginning of this financial year. It is anticipated that a large number of them will be employed during the current financial year 2022-2023. Having said that, the Minister of Finance during his budget speech made a commitment that he will find funds to make sure that these helpful workers are indeed employed within the department, which we greatly appreciate and we welcome, and we are waiting apprehensively for the funds that will come from that angle. On re-engineering of primary health care, Chairperson, we are pleased to announce that many of our community health workers have received training and are now able to test for diabetes and high blood pressure. We have trained 700 community health workers in 4 pilot districts and also given them machines to test for diabetes and high blood pressure. More CHWs from the other 7 districts will be trained and provided with these machines in the current financial year. Despite a lot of opposition from people who are misinformed, we have continued steadfastly with the implementation of NHI. NHI is an all-important tool that is worthy of our full support, as it will end the race and class imbalance that plagues our country's health sector and our society when it comes to access to quality health care. Chairperson, in a bid to improve the quality of healthcare at primary healthcare level, we have contracted 120 private general practitioners across all the province's 11 districts. This ANC-led government has also doubled the number of ward-based primary healthcare outreach teams. We have doubled from 176 that we had in 2019-2020 financial year to 352 to date. This has given many families access to primary health care, making disease prevention and early detection and treatment of disease a reality for them. To optimize the usage of our scarce resources to address the needs of our mental health patients, we are turning Fort Napier and Umzimkhulu Psychiatric Hospital into a psychiatric hospital complex, primarily because we struggle, Chairperson, with getting professionals who will be based full-time in Umzimkhulu. Town Hill Hospital already provides outreach services to Umzimkhulu by sending a psychiatrist every Wednesday. We'll be increasing this outreach support by sending an NHI-contracted psychiatrist from Fort Napier to Umzimkhulu Hospital as from May of 2023. We have also contracted a team of forensic mental health specialists at Fort Napier. The team is made up of one psychiatrist, one social worker, and one occupational therapist to clear the backlog of forensic cases as well as complement the smooth running of the justice system in relation to forensic mental health services. Under this grant, we have also continued the contracting of oncology services at Ngwelezane and Queen Nandi hospitals, respectively. This has led to improved access to oncology services to cover the north part of KwaZulu-Natal, such as Zululand, King Cetshwayo, and Umkhanyakude district. Chairperson, I now want to speak on ikhemisi eduze nawe. This, Chair, it is gratifying to see that an increased number of people who are on chronic medication are taking advantage of the program that we term ikhemisi eduze nawe, which enables them to collect their medication closer to their homes. This medication can be collected from pharmacies, community halls, churches, libraries, traditional courts, to mention but a few. All patients above the age of 5 years with chronic medication are eligible to enroll for ikhemisi eduze nawe program. But they must have been clinically stable for a period of at least 6 months, that is without having had any relapse, no experienced side effects, no needed change in medication or dosage, and must have proved to have been adherent to their treatment. This program is open to patients with various chronic medical conditions, from non-communicable diseases such as diabetes, hypertension, arthritis, to those taking antiretroviral treatment for HIV and AIDS. I must hasten to add that this program is otherwise or officially known as CCMDD in the system. We just decided to give it a more user-friendly name that is relatable to the people of the province, because if you don't do so, people are unable to understand what government is talking about. Basically, once a patient is registered, they get given medication at their respective facilities, as well as the date of subsequent collection at their pickup points of choice. SMS reminders are sent to the patient a few days before the collection date to remind them to collect their medication. The patient will also be given a review date to come back to the health facility for clinical review after 6 months, which is also communicated to the patient on their last collection at the pickup point. We currently have 891,000 clients who are actively benefiting from this program from 4,297 pickup points. Once again, we invite the people of KwaZulu-Natal, especially the elderly and their loved ones, to inquire about this system from their local clinic so that they can reap its handsome benefits. On the ballot boxes, Chair, we continue to leverage from technology to improve service delivery. We are pleased to announce that we have also installed 23 fully functional smart locker ballot boxes, mostly in the more rural parts of the province. These boxes are installed near the waiting areas at our 24-hour facilities and basically function like an ATM for prepaid medicine parcels. They get loaded by facility staff a day before the scheduled collection date. Once the parcel is loaded, the box sends an SMS to the patient with a one-time PIN or a fixed PIN that the patient has chosen, and then the box informs the patient that the parcel is ready for collection. The patient arrives at the box, enters their cell phone number and 5-digit PIN, and like clockwork, the locker opens. The patient then retrieves their parcel, closes the locker, and leaves. Just like that, they are done. This is how convenient this box works. The collection process takes between 20 seconds to 1 minute. We are planning to add 24 more new ballot boxes in the financial year and even more in the future once we have received the funds that we need. Chairperson, on technological innovation, we want to assure the people of this province that under the government of the African National Congress, their health and well-being is in good hands, and that this government will continue to work for them. In addition to ensuring the smooth day-to-day running of the department, we will continue to strengthen the health system. This we will do through, among others, investing in infrastructure development, health technology equipment, and ensuring the availability of medicine. We will also work even harder to improve clinical outcomes and clients' overall experience of care, including health promotion and improving staff attitudes, while keeping communication lines open in order to ensure recourse for all healthcare users. We have already introduced a number of cutting-edge technological innovations, and I will name just a couple of them. Let me firstly speak to the KZN Health Chat. Ladies and gentlemen, we have an exciting and innovative weekly multimedia program which is known as KZN Health Chat. This program, which is possibly the first of its kind in the country, eradicates gatekeeping by the media and enables us to interface directly with the people of this province every single week. We invite various health experts to speak openly on health matters using simple and accessible vernacular language in a bid to encourage a culture of disease prevention and enhance health promotion. This multimedia program is also a platform for the people of KwaZulu-Natal to pass compliments, which we often get, but to also air any grievances directly to us, which we then always follow up on. The content that we produce on this program is both informative and educational. It gets syndicated to various media outlets, including on our own official social media accounts, community radio stations, regional as well as mainstream media. The program has been extremely well received. Absolutely. It has grown in leaps and bounds since its inception 3 years ago, and once again displays the fact that government of the ANC is responsive, transparent, and accountable to the people of this province. We encourage those who do not yet follow this program to come on board because it's for their own good. Wozani bakithi iyasiza kakhulu lolu hlelo. Chairperson, let me speak to Bika Sikusize. In keeping with our culture of using cutting-edge technological innovation to improve the service delivery, we are also excited to report that our very own mobile health application, or to report about our very own mobile health application, which is known as Bika Sikusize, which is now live. Again, this mobile app is an extension of our ethos of transparency, accountability, and preparedness to help those who are aggrieved and or in need. Our mobile app will allow users to get the contact details of health facility, PROs, clinical operations managers, hospital CEOs, and district directors at a tap of a finger. They'll be able to send compliments or complaints to the action team in real time, receive prompt feedback, receive general health information, including that which pertains to disease outbreak. We are also finalizing our system to enable people to be able to call an ambulance using this mobile application in the future. Let me speak to eHealth Chair. In line with the commitment that we made when we assumed office in 2019, we have made considerable progress in the digitization of our patient record management system through the implementation of eHealth. The process to make the eHealth system operational at our facilities started in a phased-in approach, first in 25 of the 42 hospitals that were selected across the province. The development of the system has been completed, with 36 modules having been deployed onto the web and ready for use in these 42 hospitals. To date, a total of 2,836 clinical professionals from these hospitals have been trained on basic computer literacy and system navigation. We are also continuing to buy equipment that is needed and we have budgeted for. As we continue with our staff training in the rest of the hospitals, it is envisaged that eHealth will be operational at all 42 hospitals by the end of April 2023. During the current financial year, we will make the eHealth system operational at all 70 hospitals in the province of KwaZulu-Natal. Siyaqhuba, Stan. However, we must indicate that the issue of connectivity has been a challenge in some of the hospitals and some of the clinics, but we are working on that. Establishment on-site midwife-led birthing units, Chair, in order to continue to reduce the maternal mortality rate, the Department of Health has established the on-site midwifery-led birthing units as a pilot project at Prince Mshini Memorial and Newcastle Hospital, which are two of our busiest hospitals. The objective behind these units is to improve the quality of care from the onset of labor through delivery of the baby and reduce pressure and overcrowding at our labor wards. These units are staffed by midwives to assist women who have no risks or those whose level of risk is considered low. This is important as it will allow women who are considered high risk to get all the attention and management they need from doctors and midwives. We are piloting this project at Prince Mshini Hospital, which delivers an average of 1,000 babies per month, as well as at Newcastle Hospital, which delivers an average of 700 babies per month. Our ultimate goal is to establish these units with all our busy hospitals in order to eliminate the risk of mortality and morbidity associated with childbirth. We are also assessing the feasibility of expanding these units to other regional hospitals, including Herikwala and General Justice Kizenga Panza regional hospitals, as with many others to follow. Our plans to reduce maternal and child mortality in the province include improved immunization coverage to prevent the spread of communicable diseases, improved uptake of HIV treatment in pregnant women, educating mothers about how to prevent accidents, and how to take advantage of child health services, to mention but a few. Chairperson, it is nevertheless concerning that most pregnant teenagers still do not attend antenatal care, while others conceal their pregnancy. Many who do attend tend to book very late for ANC, which often leads to problems. Some clients who test positive for pregnancy during household outreach programs get referred, but they never reach our facilities, or they don't reach our facilities on time. We are determined to change all of this through some of the above mentioned interventions. On HIV and AIDS program, it is our considered view that given all the effective treatment prevention strategies, access to knowledge, funding, and resources, and global commitment, the people of KwaZulu-Natal should no longer be getting infected and should not be dying from HIV and AIDS. Furthermore, our HIV response plan as a province has implications for the country's effort to end AIDS by 2023. This is why we should never rest on our laurels, but always seek to intensify the level of awareness, prevention, and adherence to treatment for both HIV and AIDS, as well as TB. As a signatory to the United Nations, our country subscribes to the Joint United Nations Program on HIV and AIDS, which has set defined targets for the management of HIV and AIDS. And I will remind members, because I know we have spoken about this, on what these targets are. There are 90% of all people living with HIV must know their status. 90% of all people with diagnosed HIV infection must receive sustained antiretroviral treatment. And 90% of all people receiving antiretroviral treatment will have viral suppression. In KwaZulu-Natal, the districts of Umzinyathi, Mkhanyakude, Herikwala, and Uku have all met the 1990 targets, and we will continue to push for the rest of the districts to improve their performance. Currently, 96% of the KZN population know their HIV status, while only 83% are on ART and 93% are virally suppressed. However, we are concerned that men as a population group are still lagging behind at 96, 74, 93, while children are also lagging behind at 86, 91, 70. The main challenge is that children are reliant on their parents and guardians to tell them about their HIV status and to take them to clinic for treatment. We therefore call upon parents and guardians to pay closer attention to the children's health needs, to speak to their local healthcare providers if they are unsure of what to do, or finding it difficult to speak to their children or seek medical help on their behalf. Chairperson, overall, keeping our HIV and AIDS public messaging fresh, relevant, and effective is essential for raising awareness, combating complacency, reaching new audiences, and reducing stigma and discrimination. By keeping messaging up to date and responsive to the changing needs of our community, we can prevent the spread of HIV and AIDS and promote greater health and well-being for all. The HIV and AIDS awareness messaging that we recently introduced was very well received, eye-catching, very effective. I must add, it was controversial to a certain extent, but that is exactly what we wanted, because we wanted the attention of communities, which is what we had originally intended. Here, Chairperson, we are talking about messages such as iskun siyabhubhisa, cupha isisoka bhinqa lami, khuphuka ngoshuni wecondom, sihamba ngolayini, sidla ama-ARVs waya, sihlale sisharp, and other such messages. In the new financial year, we will continue in this trajectory by coming up with even more fresher, more relevant messages in the language that young people use, so that it can lead to behavioral change among young people. Chairperson, I just mentioned the messaging. Members reacted. That's exactly what we want from the society, because that's what it does. Like I said, in the new financial year, we will then come up with more. One will continue with this, but we will add on the ones that we already have. Ladies and gentlemen, one of the main challenges that we face as the Department of Health is discrimination that tends to get perpetrated against those who suffer diseases such as HIV and AIDS, TB, cancer, diabetes, mental health, and many more. It is important for all of us as society to realize that when we stigmatize people who are already in vulnerable state, then they then get subjected to secondary victimization through our own actions. Tragically, this can discourage or prevent them from seeking medical attention. We are requesting that we get into a partnership with the leadership of the society so that we deal with this matter once and for all. A game-changing ARV drug for neonates. As a province, we are also pleased to announce that the pediatric DTG 10 milligram drug has been registered with SAPRA. This drug is recommended by the National Department of Health as part of the standard first line treatment for children. This ART drug is dissolvable and can now be given to children around 4 weeks and less than 10 years of age, with a weight band between 3 to 20 kg. The DTG has a high genetic barrier to resistance and is also more palatable thanks to its strawberry cream taste. The drug can also be dissolved in water, juice, porridge, and yogurt, and will also go a long way towards achieving viral suppression in this subpopulation of children. From this intervention, we expect the children's viral load to be better managed. A provincial plan is in place for transitioning and ultimately switching all eligible children with HIV onto the new drug. On TB, last month on the 24th of March, World TB Day was commemorated globally under the theme, Yes, We Can End TB. This theme drives home the point that we've always made, the fact that we all need to be accountable for the eradication of TB as individuals, government, and society as a whole. We once again make the point that being regarded as the best epicenter of this double pandemic of TB and HIV and AIDS is a badge that we do not wear with pride as a province. It is certainly something that we remain committed to bringing to an end through continuous hard work and consolidation of the relationship that we have as government with communities as well as various social partners. We are pleased to observe that since 2017-2019, Umkhanyakude and Zululand have consistently achieved a treatment success rate of 85%. However, it has not been the case with Herikwalailebe and King Cetshwayo, and we hope that those members that are deployed in those districts are going to be able to assist us in ensuring that we address the matter. We continue to call for the strengthening of partnership between MPLs and the Department of Health, and for MPLs to continue to lobby communities in the fight against TB. We are appealing to the TB caucus in the legislature to play its part in ensuring that the commitment made made to end TB by 2030 are realized. I know that the TB caucus has already started on that work. We really appreciate it. Chairperson, as part of the war chest in our quest to curb the spread of TB and improve treatment outcomes during this financial year, we will be procuring 4 brand new mobile digital X-ray trucks at a cost of 1.6 million. And we will be putting these in the 4 districts that do not have these trucks, because on the other 7 districts, our partners have actually implemented or have put the trucks in those districts. Chairperson, the Constitution of South Africa recognizes the importance of sexual and reproductive health as a fundamental human right. Furthermore, our Constitution states that everyone has a right to body and psychological integrity, which includes the right to make decisions concerning reproduction. It is for these reasons that we regard access to sexual reproductive health as one of our key priorities in order to promote women's individual well-being, reduce maternal mortality, improve women's economic prospects, prevent the spread of HIV and other sexually transmitted infections. Chairperson, with that said, we continue to be extremely concerned by the high number of girls who fall pregnant during their teenage years. Teenage pregnancy can be dangerous, and as it often presents a number of health risks for both mother and baby. At the end of the 3rd quarter of 22-23, the province of KwaZulu-Natal registered a total of 26,000 pregnancies by girls between the ages of 10 and 19. This includes 1,254 girls between the ages of 10 and 14. We also have evidence that societal factors such as ukugana kwamantombazane semancane nokuthwala, which happens mostly in rural districts, as well as poor uptake of contraceptives by teenagers, are all contributing factors to this challenge of teenage pregnancy. Even more worrying is the fact that there are those adolescents who have unprotected sex, knowing that they will deal with the consequences by terminating their pregnancy. Siyafisa ukusho sihlalo that termination of pregnancy must never be used as a contraception. It is available for women who need it, but not to be used as a form of contraception. As part of our intervention to deal with the teenage pregnancy, we will also be implementing a new program to specially address the health needs of young women and girls who are at risk, where we will provide a targeted package of health education and support services. We will be seeking to address a number of interconnected health, educational, and socio-economic factors that threaten these young girls and women, such as exposure to HIV infection, STIs, unwanted and unplanned pregnancies, as well as other preventable factors related to it. Some of the guiding principles for this program are that a healthy woman rocks. No woman should die giving birth. That's what we are going to be talking to the different young women about. As instructed by our Honorable Premier, to stem the tide against teenage pregnancy, we will be joining forces with the Department of Education. Our objective in this regard is to develop and implement a robust and highly effective plan to get teenagers in this province to not only hear our message, but to embrace a new culture of preventing unplanned and unwanted pregnancies and its many associated pitfalls. Our emphasis is on abstinence for young people so that they can focus on their studies. We want to denormalize teenage pregnancy because it really is abnormal. But we are also saying to those who can't abstain from sex that there are alternatives that can protect you against sexually transmitted infections as well as unwanted or unplanned pregnancy. Our message to parents and school governing bodies is that not talking about sex does not mean children are not having sex. It's an issue that we must accept. The time of sweeping matters of sex, sexuality, and sexual reproduction health under the carpet is over. Ngakho-ke sithi kubazali sizoba ney'nhlelo okungenzeka zingehli kahle kubazali noma ilanguage mhlambe siyikhuluma uma siyikhuluma ney'ngane abazali bangayizwa kahle, kodwa siyacela kubazali ukuthi sibambisane kulolu daba, ngoba uma singalukhulumi ney'ngane, uma singakhulumi ney'ngane ngelanguage abayi-understandayo nelanguage engezokuba ambiguous, sizoqhubeka njalo siney'nkinga and the future of these young people will be destroyed. Yes, these are not easy conversations, we agree, but they are conversations that we definitely need to have. Let's give children the right kind of information and allow them to make the correct choices, rather than throw them in the lion's den of misinformation and its dangerous consequences. Our plan also involves having dialogues in schools and local communities to actively promote sexual reproductive health and family planning options. In this regard, we will be promoting the use of condoms and female contraceptives, including the long-active reversible contraceptives such as implants for youth who are sexually active and post-delivery. Chairperson, we continue to prioritize women's health. However, our society will never reach its full potential or thrive until men come on board and join in our quest to improve health outcomes. Whether we like it or not, the reality is that most men subscribe to the norm of masculinity and discourage any behavior that may make them weak. Kuthiwa indoda ayikhali. Udaba ke singavumelani ngalo. Men are taught to be self-reliant and not to show any emotions, while they neglect their own health and well-being in the process. Even when they are sick, bayayiqinisa. And when they eventually do seek health care, they tend to be very particular about who they confide in about their troubles. Bayafika sihlalo ekliniki uma ngabe bona ukuthi umuntu omsizayo kungayingane encane ecishe ilingane neyakhe, uthi uma efika ephethwe ikhanda, uma efika elethe i-STI athi cha ngane yami ngiphethwe ikhanda, sigcine singasakwazi ukumtreata for isifo esimphethe ngoba uyasaba ukukhuluma nomuntu oseduze kwakhe ngendlela okuyiyona yona. At the same time, we have noted with great concern the emergence of more cases of male urethritis syndrome, which is an STI. If left untreated for too long, this type of infection can cause damage to the organs. It can also spread to the blood and result in sepsis, which can be deadly. We believe the incidence of male urethritis is too high. These developments come on the back of our recent announcement regarding an increase in the incidence of another deadly sexually transmitted infection, which is syphilis. Chairperson, we made a commitment in our previous budget speech that we would ensure that at least 80 health care facilities have male nurses dedicated to men's unique health needs during the day and after hours.
Your time is up. Let's open negotiation.
Yeah,
how many minutes that you want me to deduct from your response time?
7 minutes.
You will be granted, Honorable.
Thank you very much. I negotiate. Oh, Rogers, you are not going to give me. All right, we can start. Thank you. Thank you, Chair. We have since made some progress in this regard, and we're able to see at least 21,000 men for various ailments at facilities that have this newly established services that is dedicated to the health of men. To date, we have ensured that 29 local municipalities are covered to address the health of men, and we will be focusing on the remaining 14 municipalities, incorporating 30 healthcare facilities in total. We will continue to discourage promiscuity and other forms of risky behavior. We have heightened our emphasis on sex education among men during our engagements. The focus has been on promotion of condom usage as well as the prevention of STIs, including HIV. This we have done through our men's dialogue platforms, which is Ikosombela Machita Nesmaya Samadot. During these discussions, we also preach a message of early presentation to health facilities. In addition to strengthening our condom distribution system, we will procure dual testing kits, which will enable us to test pregnant women for both HIV and syphilis. Chairperson, on reduction of medical legal bill, when it comes to efforts to reduce our medical legal bill, the establishment of the panel has assisted the department a lot. In the past year, we have saved close to 300 million rands that would have been paid otherwise to litigants, and that might not have been litigants that would not have been deserving. These cases have some of these cases have either been withdrawn or settled out of court. Furthermore, the centers of excellence that we've established to provide continued care to patients born with conditions such as cerebral palsy are up and running at eThekwini and uMgungundlovu. eThekwini, these centers are in Victoria Mxenge Hospital, formerly known as King Edward, and also involve the KZN Children's Hospital as well as the Phoenix Assessment Center. eMgungundlovu, the centers are in Gray's Hospital as well as Pietermaritzburg Therapy Assessment. Siyajabula kakhulu-ke ukuthi silitholile ithuba lokuthi lama assessment centers, lama centers of excellence siwasebenzise, because kuzosiza ukuthi uma sesiye enkantolo ngolunye usuku, uma inkantolo isivumile ukuthi abantu abagulayo kwesinye isikhathi abadingi ukuthi banikezwe imali upfront, sizokwazi ukuthi sibasize kulama centers, particularly ingane. Chairperson, ama-claims esayesiwathole, u-60% wawo is in relation to future medical cost. Future medical cost ke sikwaziyo ukuthi siwa-provide in our own facilities. So si-ready ukuthi sikwenze lokho. Ikhona i-case, i-judgment ese-Eastern Cape, lapho esilinde khona ukuzwa with bated breath ukuthi inkantolo izothini. I-court in the Eastern Cape judged ukuthi i-Department of Health ayidingi ukuthi ikhokhe ama-future medical costs, because i-department uma ingakwazi ukuprove ukuthi it will provide those services. Kodwa, the matter has been taken up to e-appeal, so we are waiting, Chair, ukuzwa ukuthi inkantolo izogcina ithini. Kodwa siyathemba ukuthi izovumelana nathi and will be ready as the province of KwaZulu-Natal. On emergency medical services, ladies and gentlemen, the key objective of any EMS is to provide medical care, transport that is timely, reliable, and effective. This work also entails rendering rapid and efficient medical care to stabilize and treat patients who are critically ill. We are going to be adding EMS vehicles, Chairperson. As you can see, the members will see we have actually put that down to indicate how many. We also just want to indicate to members, because we have seen a huge number of attacks on our EMS people, EMS staff, and we hope that comes to an end, because Chairperson, on forensic pathology services, we are going to be building 3 new medical legal mortuaries ezobisejozini eMtubatuba naseFryhead, futhi sizokuthenga imoto ezintsha ezintathu ezu-18 to assist in ensuring that umsebenzi uyenzeka. On government garage system, as uNdunankulu ayesitelile ukuthi sikwenze lokho, sizothenga imoto esizozisebenzisa kube sengathi ziyama mobile toolbox, u-CFO wethu ibiza kanjalo, iba i-mobile toolbox ezokwazi ukuthi ihambe iyosevisa imoto noma ilungise imoto on site, instead of having to wait for 6 months for the ambulance ukuthi ibuye sibe singazi ukuthi kwenzekeni lapho ihleli khona. We hope that's going to assist us very much moving forward. Chairperson, we have employed a CFO. We are very happy with the process. We are working on irregular expenditure and and goods and services as an outcome that was raised by the Auditor General. We hope that at the end of this financial year, ama outcomes to azobeseshintshile because of the work that has been done by UCFO and his team. Siyakubonga kakhulu lokho. As I conclude, I would also like to once again convey a word of gratitude to all the departmental stakeholders, including our social partners, for supporting our efforts to take care of the health care needs of the people of KwaZulu-Natal. I am also immensely grateful to the department's executive led by Dr. Shabalala Siyabonga kakhulu. I wish to thank all the staff in the ministry and other support staff within the department who have assisted us and continue to assist. I also thank the people of this province in advance for heeding our call to form a social partnership between themselves as government. Thank you in advance for taking better care of yourselves, for preventing diseases, and for presenting to healthcare facilities early before complications set in. Chairperson, I wish to thank my family. Ngiyabonga kakhulu ngesupport. Ukube bebengekho ngaba ngikwazi ukuphila impilo engiyiphilayo, ngabe ingane zami azinabo abantu ababanakelayo. Ngiyabonga kakhulu kuma wami uMavulakazi, ngiyabonga kuMagujwa. Mpembe kalokhothwayo ukhona laphana, my siblings, uSithembile, uSicelo noNokwazi, my kids, uLwazi Lwandile, uLethu Kwazi, uZihlelele sino Nhlelo, and last but not least ngiyabonga kakhulu kuMadlokovu Ntusi Yenkomo. Siyabonga. Chairperson, I thus present to you uhlala uzolutho happily married ngeke nike. I thus present to you 2023-2024 as follows. Vote 7, administration, 1.2 billion, district health services, 26.3 billion, emergency medical services, 1.6 billion, provincial hospital services, 12.1 billion, central hospital services, 5.4 billion, health sciences and training, 1.4 billion, healthcare support services, 354 million, health facilities management, 1.9 billion, a total of 50.6 billion rand. Siyabonga kakhulu, Sihlangu.
Thank you very much. Thank you very much, Honorable MEC. Angizwakali. Umangazi, ngathi ngiyamemeza. Thank you very much, honorable members. Can we continue with our work, honorable members? I am told I'm not audible enough. What is the problem? Yeah, that's what I've been told by the reliable officials of the legislature, that I'm not audible enough. But colleagues, we really thank you, Honorable MEC, for the presentation, and we are continuing with the debate. We now humbly invite the chairperson of the Portfolio Committee on Health in KZN. This is Honorable N.R. Majola. She is allocated 10 minutes to present the committee report. So, Honorable Majola, the platform is yours. Uhlala le emuva njengami simlindele nje hayi. Sizoba patient, honorable member. Thank you, Chair.
Thank you, Chairperson. Honorable Speaker, Deputy Speaker, Honorable Premier, Leader of Governance, Chair of Chairs, Deputy Chair of Chair, Magujwa, Honorable Political Head of the Department, colleagues, distinguished guests, we greet you all. Honorable members of the House, allow me to open with the following quote. Open quote, for he who has health has hope, and he who has hope has everything, close quote. These words give credence to the necessity of a good health in a country. A healthy population is a vital requirement for a sustainable and a strong economy. Likewise, a strong economy is necessary to produce sufficient resources to support the health systems of the country. The Department of Health in KwaZulu-Natal plays a fundamental role in the health of our people and indirectly the health of our economy. It's important then that we view our expenditure on health as an investment to the well-being of our people and the well-being of our economy. Investing in health programs which support the well-being of our communities enable them to remain healthy, productive, and economically active. A healthy population and workforce are indeed more productive, which will bode well for the economy. Similarly, economic opportunities in the economy motivates and enables people to invest in their health. Honorable members, we know all too well that the financial resources of the government are not limitless. We must be careful with the use and allocation of the limited resources we derive from our economy. We need to efficiently allocate tax revenues to programs which facilitate economic growth, such as investment in infrastructure and investment in our community's healthcare needs. We must always strive to use what we have been allocated in a manner that best serves our communities. We must be steadfast in the use and monitoring of our limited financial resources. These financial resources are garnered from an ever-decreasing slice of our society, those of us who are employed and who contribute to the coffers of the country through our taxes. Honorable members are no doubt aware of South Africa's high tax GDP ratio. This ratio compares the tax revenue of a country to the gross domestic product. It can be used as a measure of how well we as the government utilize our economic resources, the higher the ratio, the more critical it becomes that we use these resources in a manner which propels our economy forward. As the Portfolio Committee on Health established in terms of the provision of Rule 122 of the Standing Rules of the Legislature Committee, we understand that a key challenge for the department is the impact of the budget cuts. Budget cuts born from the need to limit spending due to limited economic growth. The effects of the budget cuts, we understand that the cuts of the country and the province budgets were implemented to allow the government to narrow the budget deficit and stabilize our ever-growing debt pie. By doing this, it was anticipated that the country would be able to gradually restore the growth within the baselines of the key service deliveries and infrastructure programs. These cuts have, however, made it difficult for the health department to effectively sustain or improve upon the current levels of service. The budget cuts have added to the existing pressures within the medicine, medical supplies, and laboratory services, which are all critical to the day-to-day functioning of the department. The limited growth in the baseline has made the prioritization of funds increasingly difficult. We understand the plight of the department. It has been given a sizable budget of 50.7 billion, but these funds are used to cater for the health services of all uninsured citizens of the province. According to 2021 General Household Survey, 10.5% of the population in KwaZulu-Natal are members of medical aid schemes. This means 89.5% are not medical aid members. For KwaZulu-Natal, this translates to 1.2 million people being members of the medical aid schemes, while approximately 10.4 million look to the department to cover their healthcare needs. In terms of the department of the committee oversight activities, the committee held a meeting on the 20th of January 2023 with the community of the Utukela district. CFO. The objective of our meeting was for the community to be given a platform to engage with the Department of Health on its APP and draft budget for 2023-2024 financial year. It is through these engagements, coupled with independent committee oversight work, that the committee can further appreciate the challenges facing the department and communities. The Portfolio Committee was informed that the KZN Department of Health has been allocated 50.7 billion to improve the health outcomes of the citizens of KwaZulu-Natal. The department's budget is projected to grow from 50.7 billion to 54.9 billion over the 23-24 MTF period. The Portfolio Committee is pleased with the addition of 1.5 billion to the budget in the 23-24 financial year and further 1.58 billion and 1.6 billion over the rest of the MTF period. This is a welcome despite from the ongoing impacts left by the budget cuts. The additional funding is needed to offset some of the fiscal pressures the department has had to endure. This is by no means sufficient to allow the department to operate optimally, but it is a step in the right direction. These additional funds may assist the department with the ever-rising cost of fuels needed to power their generators. The committee was informed that the department's generators are continuously working to limit the effects of the load shedding. Rising fuel costs also has an impact on the running cost of the emergency medical services. This much needed service plans to increase the average number of daily operational ambulances from 179 by mid-year of 22-23 to 200 by 31st of March 2024. It's hoped that number could be raised even further. However, we understand the limitations imposed by the current budget. It is encouraging that despite the province having to cut back its spending by 270 million in financial year 2023-2024, the Department of Health will be excluded from further budget cuts. Provincial Treasury is conscious of the effect that the ongoing budget pressures are having on the department's ability to deliver services to the public. As one of the province's big spenders in respect of infrastructure projects, I must commend the department on scoring 94% in this in its motivation on the health facility revitalization grant. The high score and its ability to show, it shows that it has the capacity to spend the funds. That one, it is highly appreciated. It is understood that primary health care will continue to be prioritized. It has been allocated approximately 52% of the total budget. This is an essential component of the department's healthcare offering. It's noted that the department will continue to implement the rationalization of services in district and specialized hospitals across the province, particularly where there is a trend of low bed occupancy rate, and low demand for service. The committee has also noted that the department intends on increasing the number of clients on ARV treatment from 1.56 million to 1.7 million in 22, 23, 24. Lastly, the committee is pleased to hear that the department plans to award 480 bursaries in the 2023 academic year to internal employees to study various qualifications. This is up from the 360 that was proposed in the previous year. We were, however, concerned that the number of bursaries awarded to first-year nursing students was decreasing to 120 from 2021-22 baseline of 160. The committee was promptly informed that the awarding of bursaries would now be much more targeted with a focus on encouraging studies towards developing specific skills required by the department. We have commended the department on their decision to employ a more focused approach when awarding bursaries and encourage this to remain as norm going forward. The adoption of the budget, the Portfolio Committee supported 23-24 budget on the 12th of March 2023 as follows. The African National Congress supported Inkatha Freedom Party, supported Democratic Party, supported Economic Freedom Party, Fighters not present, Minority Front supported. In conclusion, Honorable Speaker, the Portfolio Committee supports both 2023-24 budget and APP of the Department of Health. The committee supports the programs of the department as it pledges to continue to develop on the health services it offers to the people of KwaZulu-Natal. The committee notes that the department's financial needs are greater than its available resources, but encourages the department to maximize what has been made available to it and continue to diligently serve the people of our province. Scarcity is an economics concept rooted in one of the most basic facts of life. Thank you.
It is the time that is causing conflict between you and I. We are now, honorable members, proceeding with our debate. We now invite the speaker from the African National Congress, and this speaker is allocated 11 minutes, and the speaker's name is Honorable N.R. Majola.
Thank you. Honorable Speaker, Deputy Speaker, Honorable Premier, the leader of the governance, Chair of Chairs, Deputy Chair of Chairs, our political head of the department, Honorable Noma Gugusimelane, known as Googles, colleagues, distinguished guests, I greet you all. I really feel so honored to be part of this debate on Vote 7, which is health. I wish to start with the definition of health as defined by World Health Organization far back in 1948 as follows, open quote, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, close quote. Chairperson, at that time, this formulation was so insensitive because of its distance between the majority of poor and the minority of haves, as well as the ambition it has in ensuring breadth and ambition. The question then is, does this definition still stand? And the answer is no. Even at that time, there were voices indicating that health is not static as pronounced in 1948. This gave rise to critical thinking and analysis thereof, whereby the consideration on the opportunity to revise the definition of health, adapting it to the changed conditions of the world population was indicated. That shift gave rise to a proposal for a new definition focusing on the ability to adapt and self-manage in the face of social, physical, environmental, and emotional changes. Chairperson, even though adaptation and self-management are important qualities, but we have to question the extrinsic conditions to which health is subordinate. Thus, if we evaluate this definition as suitable, we must clarify how health is necessarily linked to socio-economic and environmental policies, paying attention to the procedure to be followed in order to pass from what ought to be what it is. The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, color, or creed. And Chapter 27 of the South African Constitution emphasizes that, Chairperson, it's not an assumption that apartheid was one of the most decisive forces molding the South African healthcare system as well as health of the people at that time. In its decisiveness, it resulted in grave race-related disparities, inequalities, fragmentation and discrimination on the one hand, and divergent race-related health outcomes in the health indices and health statuses of the different color groups. We salute our liberation icon, Tata Nelson Rolihlahla Mandela, our first chief executive of South Africa and the first elected in a fully representative democratic election. His government focused on dismantling the legacy of apartheid through tackling institutionalized racism, poverty and inequality, and fostering racial reconciliation. Chairperson, let me welcome the policy budget statement by the political head of the department, Honorable Ms. Nomagugu Simelane. The reason behind the introduction that critical analyzing definition of health is to align it with how fiscal policy has been treating the department as far as budget is concerned. As the committee, we welcome and support the budget appropriated to the department. In this fiscal year 2023-2024, the department received 50.7 billion in funding, which is approximately 800 million less than adjusted budget of last financial year. The budget for the previous financial year 2022-23 totaled 51.5 billion. This is a reduction approximately 1.6 from one year to the next. The reduction is available funding is due to budget cuts. The department receives 1.5 billion in the 2023-2024 financial year and a further 1.58 billion and 1.6 billion over the rest of the MTF period. This is a welcome break from the ongoing effects of the budget cuts implemented in the previous year's MTF, which are impacting the department. The additional funding will enable the department to offset some of the fiscal pressures it faces on a continuous basis, such as compensation of employees, cost on medical claims and property payment expenses, for example. We have to agree that as much as it is, the funding will not enable the department to cover all its costs. Chairperson, having done the above analysis, we have to commend the department for its continuous achievement on what the Section 27 of the Constitution has stipulated. It made it clear that everyone has the right to have access to healthcare, food, water, social security. The state made it a point that it takes reasonable legislative and other measures within its available resources to achieve the progressive realization of each of these rights. In my opening of this debate, I mentioned Tata Nelson Mandela, whose focus was to dismantle the legacy of apartheid by tackling those institutional racism. Yes, this was started by the establishment of the Constitution, which is the Bible of all South Africans. After that, there was an establishment of the Office of Health Standard Compliance, an independent body brought up by the Chapter 10 of the Health Act of 2013 to ensure that both public and private health establishments in South Africa comply with required health standards. Chairperson, for universal coverage as an outcome of healthcare, I would say without failure that introduction of national health insurance policy is the only tool to be implemented. Looking at the department, I can say and confirm that it has achieved a lot. Our province has been and continue to be used as benchmark on a strategy called the Ideal Clinic. The requirements needed to qualify as an Ideal Clinic are prescribed by the Office of Health Standard Compliance, which is an independent body. Today, we have more than 25 clinics qualified on gold and some on platinum. These clinics, both on gold and platinum, have initiated the NHI based on the norms and standards laid by the OHSC. Chairperson, achieving universal coverage on healthcare and tackling inequality as far as health in the province is seeing the light. Having listened to Treasury during Second Adjustment Appropriation Bill 2023, it has made it clear that according to Government Gazette number 47/789, issued in terms of Section 18 of DORA 2022, the Gazette sees the stopping of funding from provinces that are not in compliance as far as DORA prescripts are concerned. To be specific, without mentioning other provinces, I feel it is relevant to mention Western Cape Province that has failed to spend 8.641 million. It is humbling indeed to hear that in compliance with Section 19, an amount of 19.36 million is relocated to KwaZulu-Natal. Thank you so much. This is because of the APP of the department that seeks to implement the indicators that talk to the universal coverage outcome. This is manifested by the fact that all other health facilities are implementing different NHI initiatives like CCMD, PHC, general practitioner contracting, ideal clinic, and ideal hospital realization and maintenance. The adoption of the ward-based primary healthcare outreach teams is also supporting the same initiative of the NHI. Chairperson, this government has come up with different strategies to fight apartheid legacy. To be specific, I will mention the grant called the Health Facility Revitalization Grant. The expenditure for this year is 101%, which also put the department in good chances of getting more than what they got in 2022-2023. Chairperson, we have to appreciate the strides of the department, where it has managed to push the barriers of operation as far as technology is concerned. Our health facilities were a disaster when it comes to record keeping. Today, the department has achieved what we call a cost-effective and secured use of information and communication technologies in support of health-related fields. Thank you, ANC government. Today, multiple interventions that accelerate health accessibility are in place, and to mention few, the telemedicine, the mobile health, electronic medical or health records, big data, and even artificial intelligence. Chairperson, this is adequate ICT infrastructure. This adequate ICT infrastructure will be made available to all health facilities through the implementation of the Digital Health Strategy 2019-2024. This will assist in development of a case management system collaborating with special investigating unit to investigate alleged fraudulent claims that have been seen as ripping the department. As much as we appreciate these developments, it's noted with concern the issue of data center in Ulundi, which is always down, impacting negatively to objectives of the e-health. As I close, let me quote Nelson Mandela when he said, open quote, "Health cannot be a question of income. It is a fundamental human right." Close quote. ANC supports the budget. Yabule.
Thank you, Honorable Machola. Next will be from IFP, Honorable NJ Nkwanyana will be debating for 15 minutes. Honorable Nkwanyana, timing.
Thank you, Chairperson. Greeting to you and the members of the House. Chairperson, uyadumaza nje ukuthi namhlanje sizolala inkulumo ezokwethulwa ungqongqoshe kaKhongolose obhekene nezinsolo ezishaqisayo ezaphuma kwelinye iphephandaba i-With the Witness ngomhla ka-2 March 2023 ngaphansi kwesihloko esithi Health MEC accused of approving questionable employee claims. The article stated that, I quote, KwaZulu-Natal Health MEC Noma Gugu Simelane breached the separation of powers doctrine meant to curtail the abuse of power in government by approving relocation allowance payments to several departments of employees, some of whom were already died dead when the payments were made. This is according to a report compiled by lawyers contracted by the department to give a legal opinion on the department's decision to pay about 90 employees costs related to the workers. Relocation from Ulundi to Pietermaritzburg almost 2 decades ago. Akwethusi-ke nokho ukuthi ungqongqoshe kaKhongolose engenza lo mkhuba ngoba vele isisho sithi inkonyane yomganga yeqa lapho kwehle khona unina. Inkohlakalo isiphenduke isiko uKhongolose. Ushiya ungabazane lokuthi sonke lesi sabelizimali somnyango sizokwenza kahle yini okufanele. Ungqongqoshe uzovusa abasebenzi bomnyango asebashona athi bayaphila kuze kudliwe imali. Nhlonishwa nduna usihlalo udaba undunankulu lolu daba udinga ukuthi umhlonishwa uSimelane aphendule ngalo. Sibili, ngiyathanda ukudlulisa lo myalezo kumhlonishwa ungqongqoshe uSimelane mayelana nendlela asiphatha ngayo uma kunemhlangano yekomiti lomnyango aphathiswe wona okuyinto asuke eyibhekise kithina njengamalungu esishayamthetho uma simhloma ngemibuzo. Therefore, I urge Honorable Simelane, don't let your ego hijack your leadership effectiveness. When people get caught up in their egos, it erodes their effectiveness. I wonder what made you MEC to get agitated by my questions. What was the need that drove you to act egoistically? Ehlisa ukuzithwala ngoba wavuma ukusebenzela abantu. Budget allocation. We welcome 50% billion budget allocated to the Department of Health for 2023-24 financial year. Akuyona-ke bakwethu budget yokhetho lwa-2024 leli ngoba nizokwenza lokho ngiyanazi. The budget that is being tabled today before this House must fulfill its intended purpose. As we speak about billions of rands, it is essential that people, even those in rural areas, see a change when it comes to healthcare services. This budget must spend prudently. We want to see the department getting a clean audit outcome without findings. Okunye siyakwamukela ukufakwa ama-generator esibhedlela njengoba ugesi uhlupha ngalendlela ngenxa kahulumeni kakhongolose osuhluleke wanqama ukuxazulula inkinga kagesi. It is undisputed that in KZN, staggering 81% of households rely on public health service. In addition, KZ Department of Health is experiencing a shortage of medical staff and the increasing size of the population. 2022-2023 APP shows the number of professional nurses per population of 100,000, that is 152.5%. This proportion represents 17,816 professional nurses and medical technicians per 100,000 people, servicing a population of 11,583 million. The total population in KZN serviced by an average of 3,234 medical doctors. This number represents approximately 27.4% of the required proportion of required health professionals. From the outset, the IP wants to see the health budget addressing most pertinent issues that are affecting the proper functioning of hospitals and clinics. These issues are: 1, staff shortage in hospitals and clinics; 2, shortage of beds, as it has been the case with North Delhi Hospital, where patients were allegedly sleeping on the floor; 3, aging infrastructure; 4, the need of provide hospitals with necessary resources; 5, improve security in hospitals and clinics; 6, building more clinics closer to the people. The IP welcomes the allocations directed to infrastructure, as the department plans to spend 6.8 million over the medium-term expenditure with framework of infrastructure. During 2022-23 financial year, an amount of 258 million, which the health facility revitalization grant for flood damage caused by April 2022 floods, had challenges with SCM. As the IFP, we are saying all projects that were delayed by COVID-19 and April 2022 floods must be completed. We also want to know from the MEC how much from the 258 million within the health facility revitalization grant for flood damage caused by April 22 floods has been spent so far. Further, how much the total budget allocation for 11 clinics that are going to be built, including Twada in Msinga and Ofafa in Ikopo. We welcome the direction of funds from the National Health Insurance grant from other provinces, which brings the total for the NHA grant for Vote 7. Health in KwaZulu-Natal for 104 million. These funds must be spent wisely. The EPW grant must not be used as an AC tool garner votes for the 2024 general elections. Public-private partnership, the IP is concerned about the unending contract between the Department of Health and the Imperial Consortium PTY. This contracted state started in 2002-2003. The contract ended in 2016 and 2017 and renegotiated in 2019-2020, where it was extended for 18 months. Again, it was terminated in 2021, then it was extended again for a further 24 months. The current contract ends on 31st July 2023. Surprisingly, the department has stated that it is experiencing challenges in appointing another private partner and is exploring other means of requesting for a further 12 months agreement. Mhlonishwa Ngqongqoshe, kungani simelona selokhu njalo singanyuli sibuye sivuselele kwenza sisole ukuthi kukhona odla imali lapha. HIV and AIDS. The IFP is concerned about the ongoing ignorance about HIV and AIDS is transmitted in our society. According to 2021 figures, from Statistics South Africa, the total number of people living with HIV countrywide is estimated at approximately 8.2 million. KwaZulu-Natal accounts for 2.2 million, or 18.23% of that, which is the highest. Among adults aged 15 to 49 years, an estimated 19.5% of the whole population is HIV positive, with about 300 adolescent girls and young men aged 10 to 19 getting infected with HIV in the country every week. We are concerned the department is lagging behind in implementing ARV programs for men and children. Mandate is a cause of serious concern. Medically cut claims. No. Medically cut claims increased from 2.1 billion 2018-2019 to 23.4 billion 2019-2020. The MSC must address this elephant in the room. We want to see people contributing to this cause of medical negligence in hospitals and clinics be held accountable and made to pay those claims. These huge sums spent on claims clearly indicate that the department is not implementing measures to prevent medical legal claims. This is similar where the department has to pay contractors who have been taking the department to court for failure to honor its contractual obligations, as was the case with two security companies, LK Security and Sharks Protection, which are suing the department for 24 million over breach of contract signed in 2014. Further, the AG during an audit, which is normally done in a form of sampling, the AGG stumbled upon information about of 7.3 million tender, which was awarded to Tobza Security to secure the provincial pharmacy supply depot in Mobeni, South, Durban South. We want to know from the MEC what progress has been made thus so far on this issue. Irregular expenditure. We implore the KZN Department of Health to address the elephant in the room, irregular expenditure, as the department incurred irregular expenditure of 9.2 billion during the 2019-2020 financial year. The IFA is concerned about the delay in opening the Prince Kasarasem Hospital. We do not want any more excuses. This hospital must be opened to the public immediately. Billions have been invested in this hospital. The time of a phased opening has passed. Further, we were expecting the Honorable MEC to tell us how much is total budget allocation for the proposed hospital to be built in Mhlatuze. Kade sasitshela isibhedlela kodwa akukho okuphathekayo ngodaba lwemali yokusakha. Mhlawumbe ungqongqoshe ulinde ukukhankasela 2014 ngokwakho kulesi sibhedlela. Ambulances njalo phela. Nakuba siwamukela ukwenyuswa kwesibalo sama-ambulance kulesi ukuthi sizosuka azosuka ku-179 aye ku-200 ngo-31 March 2024. Kodwa lesi sibalo asanele ngoba abantu abaningi kakhulukazi emakhaya basalinda umlibe i-ambulance ingafiki. The IFP calls upon the Department of Health to ensure that response time is quick and efficient. The IFP reiterates its call for the protection of paramedics. The IFP proposes that paramedics must be accompanied by police when going in the dangerous areas. The department must stop gambling with the lives of paramedics. Although we understand that the MEC is not happy that the IFP exposes failures in KZN health facilities, we caution MECs Melan that the time for spin and doctrine of defending her failures is over. She must humble herself and communicate with the people. Being untouchable MEC will not solve health issues in KZN. Sihlalo wethu wosuku ngithi angikusho lokho ukuthi ngiyabezwa bayakhuluma nje bathi siyavuma uma sithi 2024 will do wonders. Sizowenza ama-wonders, nizobona kahle. Musani ulokhu ngithase ngathi nina nibethelwe njengokhona njengoba inkohlakalo ingaka nje kukhongoloza abantu sebekhathele yona ngoba sebefuna ushintsho ukuphathwa kwezandla zishintshe konakele njengamanje. Sihlalo umhlangano the IFP supports the budget. Thank you. Yes, 2024 ngizosuka la nihlale ngani.
Thank you, Honorable Member. The next speaker is from the Democratic Alliance, Honorable E.V. Baptai, for 6 minutes.
Honourable Chair, honourable members in the House, members of the press, other media, persons in the gallery and officials present, I greet you all, Sawubona. The health budget at 50.687 million, or billion rather, is 34.7% of the provincial budget. And this may sound plausible and sufficient to the uninformed ear. It is, after all, a considerable amount of money to dispose of in 1 year. Given its magnitude, it deserves meticulous planning, informed application, and close scrutiny. It must, however, be viewed in the context of the 10.4 million people who inhabit KwaZulu-Natal and the socio-economic realities that they live in. Of great significance in this context is the inescapable fact that approximately 90% of the citizenry are medically uninsured, and this places universal health care at a high level of priority, and it justifies a large slice of the provincial pie to keep our people in good health. The quality of one's life is inextricably linked to the state of one's health. That being said, I must move to the state of health of the Department of Health. And there are two indicators that speak to the experience of patients, namely patient waiting times and medical legal claims that arise from unfortunate bad experiences. And they indicate a need for improved administration and greater improved management processes, a greater commitment to Barter-Pele principles, and meticulous attention to the detail in treatment records. The department plans to roll out e-health to 42 of 70 hospitals by the end of the 2023-24 financial year. This planned implementation is not a new commitment for the department. It has been a matter of discussion for far too long, and I venture to say that we should aim higher for 70 out of 70. What does a cost-benefit analysis tell us of the impact of slow implementation, and what will it have on that ever-growing medical legal claim that the budget is facing? I will put this into layman's terms. Spending a little more on improved administration may save a great deal more by curtailing the frequency of negligence claims. Improving the levels and standards of management and supervision may have the desired effect of showing patients that they're on good hands. Every hospital and every clinic requires an effective system of record keeping, administration, and monitoring, and underline monitoring. That, after all, is our job. Anything less is not acceptable. Doing this will pay back through reduced waiting times, better citizen experiences, and the possibility of reducing those negligence claims. The notion that more money is needed to improve performance is not supported with evidence. Performance has everything to do with human endeavor and consequence management. We in this portfolio are charged with performing oversight under the leadership of the MEC, and that is to ensure that the performance of thousands of employees in the department meet minimum standards. How effective are we in fulfilling this function? The buck stops at the MEC's door, and if the department gets a bad rap, the spotlight falls squarely on her shoulders. The better and the more rigorous the oversight regime becomes, the better and the more rewarding the department becomes. I'm reminded to have a prayer that says, God, give me the strength to change the things that I can, the grace to accept the things that I cannot change, and the wisdom to know the difference. The MEC can change what we do and how we do it. That power is in her hands, and if we start with ourselves, we set the tone for the officials. And I would say, meet me at Northdale Hospital. Contingent liabilities. The growing contingent liability of medical legal claims, which was at 28 billion and forecast for 31 billion, brings attention to another issue that must be addressed. And this is the existence of critical vacant budgeted posts. A critical vacant budgeted post is an indictment on government and an indictment on government leadership, because a critical vacant post is just that. It is needed. It requires filling immediately and urgently. The compensation of employees in the department is approximately 62% of expenditure, and there is constant downward pressure on our revenue. Any failure to fill funded vacancies within several months is tantamount to negligence. It raises the obvious question about the impact that these vacancies may have on the circumstances that lead to the negligence claims. Furthermore, there are approximately 260 unemployed medical officers who need work. Does all of this not suggest a lapse in government? This may not be received well, but I make the suggestion why not visit the Department of Health in the Western Cape and juxtapose our systems with theirs. What may we learn and how might we improve? Looking at this budget, I'm left with an uneasy feeling that emergency medical services may be in danger of becoming the forgotten stepchild of our health regime. And to put my point across in practical terms, I say the following. How does one get access to the universal healthcare services on offer from this department if one is physically incapable of doing so due to one's injuries, conditions, or circumstances? And given the statistics that 90% of KwaZulu-Natal citizens do not enjoy private healthcare services because they are uninsured, the need for emergency medical services must be recognized for the essential service status it has.
Your time is up, unfortunately, Honorable Member. Can we continue with our own list of the speakers? We now want to invite the Honorable Member from the EFF. This Honorable Member is allocated 9 minutes, and the Honorable Member is Honorable Tinkosi. Mankosi, ingane kamfowethu. Mankosi akekho? Or is connected virtually? Yes, Mankosi. Wakithi Big Five futhi. Yes, Mankosi. Can you unmute yourself, Mankosi? You are muted.
Thanks.
Okay, now you are okay.
Thanks, Chair. Honorable Chairperson, honorable members of the Committee of Health, honorable members of this House, members of the media, all protocol observed, I greet you all. It is an honor to me to be delegated in this House by the economic freedom fighters to debate the issues of health that has been affecting our people ever since the year of 2019 by the COVID-19, whereby thousands of people lost their lives, lost their families, lost their breadwinners, people lost their job, and the orphans were left with no hope for the future. Chairperson, the report that was tabled by the chairperson focus, the focus is more on the department has been shifted. The focus from saving our people, and the only focus is now still in the COVID-19.
Okay.
Chair, can I continue?
Yes, continue, Mankosi. Can you stop the watch, please? You can continue, Mankosi, but there was someone who was coming in. Can we, all of us who are connected virtually, mute our mics and allow the speaker alone to have got that thing unmuted? Continue, Mankosi.
Thank you, Chair. The focus is now shifted from saving our people, as the only focus is now still COVID-19. As the chairperson indicated that the priority of this portfolio for 2022-23 annual operation plans are COVID-19 programs, monitoring of vaccine role, vaccine uptake as the result of neglecting other health issues. The quarterly target achievability from 2021 is decreasing and above 50% of decrease. Quarterly target not achieved. On the 2nd of March 2023, the department reported that out of 67 quarterly targets, only 32 were achieved and 35 were not achieved. The day the MEC and her team conducted their oversight properly, not just visiting the hospital for the purpose of fame and media, this target will be met. Chairperson akwazi ukuthi from May 2022 till today, this department only conducted an oversight in 6 hospitals out of more than 70 public hospitals and hundreds of clinics. The 2021 General Household Survey states that 1.2 million people of the population of KwaZulu-Natal are members of the medical aid scheme. 10.54 million people are non-members of medical aid scheme. That means they are using public hospitals and public clinics. That day, this government created sustainable jobs, as they always promise to their people. By doing so, the 89.5% of non-medical aid members will decrease as people will have salary and take care of themselves and their families. Chairperson, we have qualified doctors and nurses who went to school and got their qualifications but seated at home, unemployed and hungry. Where else in other hospitals like General Kizanga Panza in KwaDukuza, there is a shortage of doctors and nurses. As a result, 18 years old grade 12 learner by the name of Londi, who was spent with the NSIT, was discharged. Engaboniwa bodokotela, umzimba wakhe wawubola. Kangangokuba wayenganikwe ngisho medication nama-date wokuthi abonane nodokotela. Iwona-ke into esibhekana nayo leyo ey'bhedlela nakuma-clinics wa-locals. So ukuqashwa kwamanesi nokuqashwa kodokotela abanye kuzolekelela kakhulu esimeni njengalesi. I-General Kizenga Hospital failed dismally to assist a young lady to gain back her confidence. As a result, wadropha out esikoleni. Njengamanje uhlele ekhaya, sibonga kwingwelezane hospital eyamthatha umntwana yamgcina for 2 months, waphuma esepholile. Hayi lo mdlalo wenziwa la eGeneral Kizenga Panza Hospital. I hope that the MEC and her team bazoya ukuvakashela lesa sibhedlela ukuyokwenza i-oversight nanokwenza ubulungiswa justice iseve empilweni kaLondi. I hope the MEC and her team bazoyeka ukuya ngegugu likaKhongolose kuma-oversight, but beye ebantwini beyozwa iy'nkinga abantu ababhekene nazo ezibhedlela nasemtholampilo kahulumeni. Ebese benza something ngalokho ubulungiswa ebantwini bengagcini ngokokwenza ama-oversight kuphela behlala ema-meetingini.
You are muted, Mankosi. You are muted. Can you unmute yourself?
Oh, thanks, Chair. On the 20th January, the department visited Uthukela District municipality. It was just to go and give a platform to the community to engage the department, which is good though. But the department did not go to any public clinic or hospital to play an oversight. Sometimes the MEC and the team need to stop sit on the table. Bebe is the cool, bengaye, but they need to go and touch and feel the ground. Some need to come down from the high horse, because I don't understand why you are afraid of your people who voted for you. You even disrupt the functioning of the community service department by taking all the police wherever you are visiting the people who voted for you. Police are even neglecting their duties of arresting imidlwembe ebulala izingane edlengulo gogo, because they are busy escorting political leaders who behave like thieves or criminals. We note the service plan of increasing the average number of operation ambulance from 179 to 200 by March 2024. Siyathemba lokhu kuzokwenzeka MEC kungabi ukuthi kuvezwe nje ebantwini kuphela. Chairperson, I don't understand at all how can the department led by the ruling party complain about load shedding and the rising of fuel cost, which themselves are the one who puts our people into the endless load shedding. I wouldn't surprise if tomorrow we wake up having the MEC of generators, as they must be always full of fuel ready to back up during the effects of load shedding. The EFF appreciates the role played by a generation of political freedom fighters who sacrificed their lives, imprisoned, exiled, and separated from their families in pursuit of freedom. Okusisalele nje njenge-economic freedom fighters is to waken up the mind of our people who imaginary the freedom that is not even have arrived to the promised land. The EFF is the only political party that will take our people to the promised land of economic freedom in our lifetime. The youth of this province is becoming more disgruntled under the leadership of the ANC and the IFP. In this province, like in leadership of the ANC and IFP, in this province, like in the previous election, the youth will be fed so many empty promises on education, employment, creating jobs, bursaries, which will never be created, because there is no radically convincing plan on how this can be done. The only plan that is matter to these political parties is to fight over the position and governing of the municipalities, forgetting about their people. Ndlangamandla, ngithi angibonge ithuba, Mphazini.
Ndodakazi, thank you very much, honorable member. Thank you very much, honorable member. You made it. You were left with 14 seconds. We are now inviting the next speaker to the podium. This speaker comes from the African National Congress, and this honorable member is allocated 9 minutes. This is Honorable SM Sonjita Dlangamandla.
Ngiyabonga Sihlalo Dlangamandla. Siyabingelela kusomlomo namalunga alendlu ahloniphekileyo. Siyabingelela kuNgqongqoshe uMagutshwa. Bakhona ke abazophendula okunye, kodwa okunye nje imfishi nje. Kofanele singayihluphi ngakho. Let me premise my debate from here. Health is a foundation of a happy and productive life. It is essential to prioritize our health and well-being. It is for this reason that it is regarded as a first liberties. Edward Stanley once said, "Those who have no time for healthy eating will sooner or later have to find time for illness." Good health means that we can enjoy life to the fullest, participate in activities we enjoy, and pursue our goals and dreams. It also means that we are less likely to suffer from chronic diseases such as heart disease, diabetes, and cancer, which can have a significant impact on our quality of life and lifespan. We are in more digital connected era where either we disrupt or we are disrupted. It has become important to acknowledge the benefit of technology in improving the healthcare sector. In this, the e-health strategy represents one of the pillars of a modern health system and strategy involving the use of digital and telemedicine tools to help an increasing number of patients, reducing at the same time healthcare costs, measuring and understanding the economic value and performance of e-health tools. It is therefore essential to understand the outcome and best uses of such technologies. Chair, the Chair, honorable members, with the outbreak of COVID-19 pandemic and consequent introduction of social distancing rules, the use of e-health to monitor and assist patients has dramatically accelerated. Since the very beginning of the pandemic, e-health and control procedures, televisits, teleconsultations with experts, and data reporting and sharing. Later, more solutions were implemented to increase resilience and offer adequate assistance in collecting and sharing data among citizens. Healthcare institutions, decision makers, and public entities engage in disaster management. Several medical specialists have started to implement telemedicine and e-health solutions. For instance, the premise of using the e-health it is highlighted, increasing the importance of e-health concept, which should be studied more in depth to evaluate in details its economic value and general performance. It's our considered view that we need to study the cost effectiveness analysis, the cost benefit analysis, the cost utility analysis, so that we implement this program, Honorable MEC, because one of the benefits of this program of the e-health solutions is that we are going to be able to manage, as you said in your speech, the cases that the department is facing, what we call medical legal challenges. We think with this e-health, you will then be able to look after the files properly. You will then have records that are properly kept, so that when there are people that are taking you to court, you will then be able to produce records that will then be able to stand the test of time in our courts. We therefore urge our government, healthcare providers, and the citizens of the KZN to embrace e-health systems to improve healthcare service delivery and empower our youth through technology to be agents for change of our province. Most importantly, let us help resolve the crisis posed by escalating medical negligence claims. Let us work together to fight diseases in our province. We also think the issue of e-health. Some people, Chair yesterday spoke about the technology. There was another member who spoke about technology. Leyo yokwenza izinto ngendlela yokuthakatha. Kodwa we think now there is a problem of Dipur. We think this project, MEC, it's urgent, and we appreciate that the department has taken up this issue of technology. It's proven that our youth, especially young people, mostly use cell phones, and we think now instead of people going to hospitals for simple things, they will then be able, using this system, to communicate with doctors. They might not need to visit hospital, because at a press of a button, an SMS, you can then consult with your doctor if this is the world where the world is going. And we think the department is taking the right direction, and the generation is becoming younger. They are technologically savvy, so we must use this technology. And we think we, as the province, especially the portfolio committee, we must agitate for more money for such programs, so that we respond decisively to our challenges that are faced by our society. We think the ANC supports this budget. You are at the right track. Sorry that MEC, you might have rubbed abanye abantu ama-egos abo badly. We apologize, Umama Usemdala. uyashesha ukuzwela bakithi. That equal thing we need to discuss what happened there. Thank you very much, Chair.
Thank you very much, Honorable Member. In my list, I'm supposed to be having Honorable Shinga, and we received an apology from her that she would not make it to this debate. Therefore, we're moving on to the speaker from the ATM, who is allocated 3 minutes. This is Honorable Reverend M.E. Phakathi.
Hallelujah. Asibonge kakhulu sihlalo. Sibonge kakhulu. Cha ungangiqali nje ukukhuluma into ongayazi ngoba kuyiqiniso elimsula ngifuna ukutshela manje ATM ayisoze yaba nembimbi neDA. Noma ungakhala ushone ngapha uyephi it will never happen. Asivumelane ke ngento ethi ke ATM iyamukela isabelo semali esithuliwe lapha Honorable MEC sibukile ke uprogram 1 no program 2 siyaweseka kakhulu uprogram 1 lapho kukhulunywa ngobuxhakaxhaka kwabelungu ekuthiwa i-health system la kuzofika khona abantu bethu sibabone bethola usizo noma ikuphi la bekhona. Siyacela ukuthi ke iyandiswe imali ukuze lento sibone ukuthi ama-files abantu ayakwazi ukuthi noma esuke ePortshepstone eKwaZulu akwazi ukuyi-accessa ifile yakhe. So siyayisupporta kakhulu ke leyo. Program 2 sibonile ukuthi funa ukwandisa indlela yokusiza abantu bakithi. So hlele sikushayela izandla ke ukwandiswa kweindawo lapho abantu bakithi abathola khona usizo lwezempilo. So ke lapho ke siyacela lokho engikhulumile izolo ngizokukhuluma namhlanje ukuthi we need not to be apologetic ukusuka siya eindaweni zasemakhaya siya eindaweni zasemalokishini. Lezi indawo okhuluma ngazo noma lezi ibhedlela noma lezi insiza ozofuna ukuzihambisa kulezi indawo, you must not be apologetic about it. Abelungu ke babethi ke kuthina asibe nesibhedlelana esisodwa nje ukuze sithi mangabe singakwazi ukufinyelela kusona sife ngoba bezama ukusinciphisa. Izama indlela ukuthi ke manje ke ukuthi ke la nje uthola khona ithuba ngena wakhe isibhedlela. ATM ke iyayisupporta kakhulu. Siyabonga.
Thank you very much, Honorable Member. Those who have got the list that might not have been amended, the next speaker is supposed to be Takurash Bansi, but we received an apology from her. That's why we're proceeding with our own list. And the next speaker now is from the African National Congress. And this speaker is allocated 9 minutes. And this is Honorable NPF Mavuso, Umhlolomkhulu.
Honorable Speaker, Honorable Premier, honorable members of the executive, honorable members, distinguished guests, Honorable Chairperson, it is the government's commitment and the African National Congress in particular that says that institutions must ensure that vacant posts are filled in line with the Public Service Act, the Employment Equity Act, and other acts that impact in the health sector. Filling vacant posts ensures compliance to the set norms and standards. It is in line with this, Honorable Chairperson, that the Health Department has endeavored in pursuing its strategic intent by aligning the internal human resource processes to government's human resource policies and strategies to ensure the execution of the department's mandated functions. Honorable Chair, despite the vast challenges that are faced by the department, there have been significant achievements in some areas whilst the most prominent challenge experienced by the department is related to the compensation of the employees' budgeted allocation. In order to ensure the availability of staff with scarce skills in the department, the ratio of key personnel, like the professional nurses and medical officers per 100,000 population, exceeded the target set during the 2022-23 financial year. Professional nurse had a target of 160.8 per 100,000 population, and the actual performance is 161.8, whilst for medical officers, the target was 33.7, and the actual performance was 35.8. The increase can be ascribed to the increased allocation of medical interns and community service medical officers, and the increased appointment of professional nurses to assist in the fight against COVID-19. The increased number of staff in these categories has a direct positive bearing on service delivery. The department also employed 7,020 staff on contract in various categories to assist in the fight against COVID-19 pandemic. To date, the African National Congress applauds the department that the 1,898 of these contracted employees are now employed on a permanent basis in the department. And this needs a hand of applause, Honorable Chairperson. The absorption of these contract employees is ongoing, and their absorption is contributing to the reduction of the vacancy rate in the department. These employees play a vital role in the department and are assisting in areas where the department was unable to fill the posts, like in the administrative units and the cleaning categories. This impacts positively in service delivery as clients are attended to timeously in the patient administrative units, and health facilities are cleaner as the result of the increased resources, and nursing staff can focus on nurse-related functions. Honorable Chair, in order to ensure that the department reaps the benefit of awarding bursaries to the community to undertake the health science training, the department has appointed 201 bursary holders into medical officer posts as of January 2023. This assists in reducing the vacancy rate in the department, and more importantly, the injection of the scarce resource will directly benefit clients of the department, as waiting times will be reduced and will have an encouraging impact on the reduction of the mortality and the morbidity rates in the department. Honorable Chair, honorable members, the department awarded 462 bursaries to its employees using the skills development budget. The purpose of such bursaries is to allow employees of the department to improve their qualifications. The return on investment for the department is that these employees acquire enhanced knowledge and skills which they can apply in their daily duties, which improves service delivery to the department clients. This initiative, Honorable Chair, also contributed towards professionalizing the public service. And despite the financial constraints that the department is facing, Honorable Chair, the department has awarded 160 bursaries against the target of 120 to first-year nursing students in January 2023. The increase of 40 bursaries being awarded in June to other basic nursing courses, leading to registration as general nursing being phased out by the South African Nursing Council. The department's College of Emergency Care has recently obtained full accreditation from the Council on Higher Education and the South African Qualifications Authority to offer the one-year higher certificate in emergency care. 20 learners will commence training in the program in July 2023, and the improved qualification of staff
will lead to improved and quality service delivery to the department's clients significantly, as emergency care staff are generally the first point of contact with the clients and the department. Honorable Chairperson, the African National Congress supports the budget. Thank you.
Thank you very much, Honorable Member. The next speaker, according to my list, is coming from the ACDP, and this is Honorable S.E. Manele, the Bishop, and the Bishop is allocated 3 minutes. It's up to you, the holy man.
Hlala ne-MEC nabonke aba-MCs ngiyanibingelela nehlobo zethu zonke egameni likaJesu Kristu. As ACDP, we note and appreciate the budget. MEC, belibonga kakhulu indaba yesibhedlela saseMtubatuba. Thank you so much. Nezinye ke indawo nazo ezitholile njengoba noMtubatuba utholile. Sibonge nezipho lezi ezinye nisipha zona MEC, siyabonga kakhulu. MEC, the issue of infrastructure, I know we've mentioned about it. But what the infrastructure in some hospitals need to be maintained, because if infrastructure is maintained very well, it promotes the quality of services and the standard. So in your priorities, I know you mentioned this, but it's a matter of emphasis. The issue of ambulances, I know, MEC, sometimes when we are trying to solve a problem, another new problem emerges. By centralizing ambulances in district, you were trying to avoid the issue of mismanagement. But in the process, it takes a long time for an ambulance to attend to the intended destination. I won't give you any exercise about this, but I don't know what are you going to do, because it's the issue that we experience on day-to-day basis. You have mentioned the issue of the staff shortage, and we believe that the issue of the nursing college will assist us to overcome that problem. Thank you for appreciating those people who were forefront during the period of COVID-19. And bengakuhle laba abanye ababe-assista mphathi usale usubona nabuthi bayalekelela ebhedlela. Thank you so much. Ngiyathemba ikhona itoken yogcina ubaphe bona. Ngale kwalokho siyacela kule issue ye-COVID-19 ukuthi uma bekungenzeka onke ama-clinics ebenayo i-backup system, ngoba it's affecting us a lot, more especially endaweni enama-theatre. Uthola ukuthi i-theatre ayibandi ngendlela ofanele ibanda ngayo. Ngala mazwi chairperson, ngiyabonga kakhulu. God bless you.
Must bless you as well, Bishop. In my list, the next speaker is from the DA, is allocated 6 minutes, and this is Honorable E.V. Papti. I hope I'm pronouncing your name very well. I'm meeting it for the first time, as a teacher. I never got a Papti girl, a boy.
Honourable Chair and honourable members, I'm going to speak to the subject on national health insurance. It has come up in this budget and has been referred to in a number of ways. The department plans to employ 19 more general practitioners from the NHI grant, but I say this is something of a red herring, because it takes an absolutely necessity of employing doctors within the public health service and then attributes it to a scheme that is yet to be tested for its financial viability and its pragmatic application. So regardless of the label, the name, or the term that one attaches to the employment of doctors, they remain a natural requirement in any health system. So rather than attempting to extol the virtues of NHR, the ANC government should focus on the quality of service that citizens receive and the optimal use of limited resources to deliver those services. Grandiose schemes that ultimately seek to gain control over funds that sticky fingers can't reach at the present time should be rejected in favor of doing better with what we have. Given the propensity for looting that the Zondo Commission revealed to the nation, there's no more trust for a regime that has enabled astronomical increases in the personal wealth of a select and connected few, whilst claiming to represent the poorest of the poor. There is a canyon-sized disconnect between those they claim to represent and the champagne and caviar comrades who claim to champion the cause of disadvantaged citizens. Nationalizing private healthcare and subsuming it into a regime that has yet to demonstrate that it can deliver value for money cannot be a sensible approach. Budget cuts have become the order of the day for several years. Given our economic climate and the threats posed by organized crime, economic growth has a dismal outlook, and it suggests that further cuts may be the reality of the future. So what this requires of us is to do more with less, working smarter and improving performance through firm consequence management, not making excuses, not relying on apologies. In the same way that we could learn from the Western Cape model, we could learn from the public sector, the private sector. Rather than interfering with what is working, take from it those systems and practices that make it sought after by those who can afford it. The existence of private sector healthcare and funds it manages says something about public sector healthcare and how it goes about doing its business. The objective of universal healthcare does not imply the exclusion of private healthcare. This is not a binary choice for sustainable health services in South Africa. Attempts to force the issue of NHR through the nomenclature that is used in the budget seems to me to be a narrow and a single-minded approach. What we ought to be focusing on is not how much money we're putting in, but how much value we're getting out. Load shedding. It has hit our economy like a wrecking ball, laying waste to businesses and jobs without discrimination and without discernment. The health department provides an essential service that sustains the quality of life for the majority of KZN citizens. And the department has felt the cold winds of energy insecurity brought about those terrible twins of cadre deployment and collapsing entities. The department faces the harsh realities of energy interruptions due to the other reality of a captured energy supplier. Compromised healthcare and captured energy production are born from the same mother of all failures. I leave it to your imagination to identify who that is. There are practical difficulties with load shedding exemptions at some facilities. The network is not configured in a way that lends itself to separation from the rest of the surrounding grid. And in these circumstances, the provision of an alternative energy source is top priority for obvious reasons. It is therefore important that the department implements the necessary systems to provide optimal solutions for those facilities and takes into account the commitments made towards a just energy transition. This is particularly an area where we could learn from the Western Cape model that has made major progress in addressing the challenges of load shedding. The department cannot wait for the Minister of Electricity to figure out if the cause of load shedding is management expertise or fuel supply or the age of infrastructure, or more likely, the obvious reasons of organized crime, sabotage, and incompetence. This can't wait. The health of our citizens cannot be put on hold whilst politics takes center stage. And so I come to the end of my debate. But in summary, I say respectfully that we can learn from the performance and the standards we see in the private sector and that we see in our sister department that falls under a DA government. We can do more with less if we are serious about oversight and we set the tempo through close scrutiny and correction. We must address the general performance and attitudes of staff so that our customers, our fellow citizens, can experience the kind of healthcare that makes them happy and makes us content. It starts with good governance and it ends with good services. So let the DA be your doctor. Thank you, sir.
You want to inject me, Bapti, as a doctor. Honorable members, the next speaker that is invited to the podium is from the African National Congress. And this honorable member is allocated 13 minutes. And this is Honorable N.M. Sibia.
Thank you very much, Chairperson. Let me greet the Premier in her absentia, the Leader of Government Business, Honorable Mtombeni, the MEC of Health, Honorable Smelane, and all the members of the legislature. Chairperson, I want to start by, I do have my debate, but I think I'll be doing injustice if I don't get into some of the things that have been said here. It's very, very important because we are here to debate and there is a budget speech that has been tabled by the MEC and the members who are debating here have been part and parcel of the budget and the portfolio committee meetings and oversights and everything. But I think there are things that we need to address. But I want to start by saying something to Honorable Haynes Ulrich de Boer. I think, Chair, it's important that I just want to warn him. He must understand that you are living in a democratic state. It's a new South Africa. His behavior and gestures that he makes when he's seated there, Chairperson, I must tell you, they are so racist. Very racist. He even changes his color of his skin when he sees honorable members from the ANC debating and saying things that matters. So I want to warn him. He's young. He's of my age, 1977. And I must tell him that it's very important that he accept that the ANC is in charge, but also black people who have capacity. They are running the country, not what he's doing. Let me come into what has been said. Mam Kwanyana, sadly, I've been with you in portfolio committees for some years now. It's my 9th year in the legislature now. You see, when you have nothing to say, Mam Kwanyana, I will say you must ask your party to give somebody else to debate. You come here, you want to, to paint MEC as a person who doesn't listen, who have egos. I've been with you. We've been having this MEC for some years. Not a single day where this MEC, if you are raising issues, she has failed to respond or where she has ever been aggressive. But also I'm saying, because we do have portfolio committees, why don't you raise these issues in the portfolio committees rather than coming to grandstand here? Because there's never been a single day where you complain to the chairperson of the committee at least and say the MEC is doing wrong things. To me, you are just coming here to lie and you are old. It's a blue lie. It's unnecessary. And that's what the IFP always do. IFP has always been thriving through lies. IFP, and that's what we are doing again. We've been, I will say, come to the portfolio committee. Let's deal with what you have raised.
Staff. Honorable Sotobe, can you wait? There's someone who is standing up. I would want him to quote the rule on which he's standing.
Chairperson, I rise on Rule 74.
Can you summarize it for me so that I am sure about what is there?
Rule 74 relates to personal reflection on members and verbal abuse. And it goes into 2 sections, 1 and 2. And the first part of it relates to a member may not make, and then it provides for those things that a member may not do. So the Honorable de Boer, who the issue was raised by Honorable Sotobe from the podium, was not a member who is participating in the debate. And the House rules provide that if a member makes a gesture, allow me to finish my point of order, Chair, that if a member of the House makes any gestures, it may be raised as a point of order. But here this member comes to the podium and then makes personal reflections based on what he thinks about a member and who he is. No, it's the correct rule.
I'm raising
And
it in the
Chairperson,
legislature.
my suggestion to you is that the remarks that the honorable member at the podium made regarding the Honorable De Boer are ruled upon in terms of Rule 74. Thank you very much.
No, don't worry, my leader. We are going to check that, and then so that we don't rule wrongly. You know, that's what we are requesting that you do. But we would want to advise, honorable member, you know, when you participate in the form of gestures and whatever, this is what is instigating others to react. You know, that's what, I don't know whether people have ever seen me. You will never see me gesturing and doing anything. So we're just advising the honorable members that we must desist from doing that, because other people will be watching that. They might react, and then we'll have the reaction that is unending. So sit down, honorable member. We have indicated that we are going to check what you are raising. Oh, honorable member, you are up.
Yes, I'm up.
Oh, I didn't see you.
Chairperson,
Yes,
I'm
rule,
raising
ma'am.
the issue that was said by Honorable Dom. He mustn't say something which doesn't
No,
know.
honorable member.
I know about what I was doing.
No, honorable
He
member.
mustn't take me as if I'm a fool.
Honorable
right in my
member.
head.
Honorable member, you know the rules of the House. Before you speak,
Hayi hlala phansi
before you
bamkwanyana hlala
speak,
phansi. Hayi.
you tell the presiding officer the rule that you are standing up on, and then that presiding officer will check the correctness, and then if it is not so, and then will allow you to speak if it is so. May you sit down, ma'am, because you are not coming up with any rule in terms of the rules of our legislation.
This one.
Can you sit down, please? Honorable members, we shouldn't waste our time. I am repeating this. When you want to stand up and then interfere with the debate, not a correct name, interfere positively with the smooth running of the debate, you first quote the rule on which you are standing. That's the first thing that you do. And then you allow the presiding officer to give you the opportunity when he or she is convinced that you are standing up on the correct rule. Those are the procedures of this legislature. I see another honorable member standing. Yes, honorable member, can you quote the rule?
Thank you very much.
On which you are
Chairperson,
standing?
I rise on Road 57-1A on a point of order. The Honorable Nkwanyana has defied your instruction. The Honorable Nkwanyana has sent a gesture to Honorable Sbia. We request also that the Honorable Nkwanyana withdraws all that she has said prior to what you have just said, because she was grossly out of order. First, by standing up, not recognized, by standing up, not quoting a rule, and further interrupting the sitting. We request that the honorable member withdraws. Otherwise, we will then request that further interventions be done against the honorable member. Thank you.
Honorable member Nkwanyana, you have heard the request. Can we check if you are prepared to withdraw what is said to have been done by you? And then that's what I'm requesting as the presiding officer. No, honorable member, there is an allegation that you said something to the honorable member who is on the podium. What you said, it was before the presiding officer allowed you to speak. That is the first thing that it is alleged to have been done by you. Then secondly, you were requested to quote the rule on which you are standing, and you did not comply with the request of the presiding officer. Then the third thing that is indicated is that you sent a particular gesture to the honorable member who is allowed to be on the podium. This is what the honorable member was requesting you to do, to withdraw those.
Chairperson, I withdraw. But there is no but. I withdraw.
All the part that I don't like, but I'm happy that you have withdrawn. And then, no, that honorable member is out of order. That one who's calling someone outside is out of order. Honorable Smear, can you continue with your debate?
Thank you, Chair. I expected this, Chair. Yabona mawushaya ethanjeni kuyazwakala. We have touched the nerves. You can see ukuthi abantu banjani. Kusele ukuthi bacimbe lapha kwamatafula. That's what they know better. So we are continuing, Chair, because one thing, Chairperson, that we are not going to allow is when members are going to come here and lambast the MEC, make some more allegations. Ungamunkwanyane la uraiser into tudumela ukuthi MEC uzo kwethula budget speech kube kuneinsolo and uthatha insolo uzenza the real case as if they've been proven. She went further, saying a lot of things about the MEC ngezinto that have not even been tested, and it's very embarrassing to me. I think she was not prepared. She came here unprepared, and the good thing that she thought she must do is just to try and do mudslinging up and MEC as a bad MEC. It's because the speech was perfect. The work that the ANC is doing is perfect. The ANC government is delivering to the people of KwaZulu-Natal when it comes to health. That's why they will come and do this. So further, you know, when she says she wants to know ukuthi imali disaster, how much it has been spent. My worry is that you've got members who literally comes unprepared here. You've got a portfolio committee. You've got space in the legislature to ask questions. You come here, you ask questions because you want to paint a picture that the money at disaster is not spent accordingly. You've got all these platforms to ask questions and get proper answers, but you choose to come here because you are not prepared. That is IFP, and we know you for that. We see you for that. But further, we are saying the department must not use imali isebenzise kahle, ingayisebenzisi to gain a vote for the ANC. We are not IFP. The IFP is doing exactly that. Komaspala, imali yabantu like it's going to be out of fashion. Imali niyidla every day komaspala nisebenzisela yona ukuvota nithenga abantu and every. ANC doesn't do that. MC namhlanje abantu abanalutho, eNkuthu abanalutho, eNkandla abanalutho. You can go everywhere because Inkatha can deliver. All you do, you use imali for your own purposes to fund the IFP. We don't do that. Look at the delivery that we have made for the past 29 years. There is evidence. The MEC has said it here. The members have said it here. So, I think, Babdi, you are honestly, if you say 90% of people of KwaZulu-Natal are uninsured, it's a confidence to the government of the day. They are dependent on the ANC public service. They are dependent. By the way, I'm one of those who are dependent on public hospitals. I don't go to private hospitals. I don't even have medical aid with my family. So we are very confident that this government is doing so well. That's why 90% are uninsured, because this government is providing them with proper healthcare services. You are saying more money is needed, there is no need for more money to improve performance. I think again, you lack thinking and proper superior logic. If you are a thinker, you'll understand that you'll need more resources to improve performance. By the way, let us be specific. We're talking about health here. To improve performance, you need more doctors or staff. You need the infrastructure. We're talking about hospitals, clinics. You need quite a lot of things that can, ambulances. The performance can be improved. We're not only talking about the MEC. We're saying everything is in the hands of the MEC. The MEC is only one person. She can't single-handedly do everything. By the way, she's a leader who gives strategic leadership in the department. So you need more to train the staff. That is money for your information. Please think before you come to the debate. You need to be prepared as well. It's very, very important. And further to that, the EFF, oh, poor EFF. Poor EFF. Let me say this, the EFF, honestly speaking, the level has never been this low with EFF. This was the worst ever debate by the EFF that we have seen in this legislature since the arrival of the EFF. Member, honorable member, I must say, honestly speaking, please, EFF, help her, train her, tell her to come to portfolio committees so that she will know that it's us as the portfolio committee who do the oversight, not the department. She says the department goes and do oversight and this and that. She still doesn't understand the system because she doesn't come here. Even now, she's seated at home because honestly speaking, if she was here, she will understand how the system works. If she doesn't understand the system, then she won't understand what is being done. She didn't say anything about what the EFF can do for the people of this province. In fact, I'm wasting my time when I talk about the EFF. And then unento ayishilo enye ngicabanga ukuthi we must talk about it as well. Uyabona umethi iANC i-department ihambe iyogqamisa ayiyeke ukuyogqamisa i-ANC umihamba iyokwenza ama-oversight angisezona-ka ukuthi oversight. But this department is led, it's the government of the ANC. U-MEC akahamba elapha afika akhuluma athi hayi ukhulumelana nama-branch usuke ehambisa ama-healthcare services kubantu. By the way, Kwizogama, she's the deputy chairperson of the ANC in the province. What are you expecting? You want her not to be the MEC? We're in charge, we're running the province and we're making sure that they are getting proper health services. So, and it's very, very important. Honorable Bart, lastly, on you. NHI, if you say NHI is not tested, I think again, please do your proper research. Go to Britain and see what NHS is doing. Go to Britain and see what NHS is doing. And we're implementing NHI in this country. We're not going to go back. There is no turning back. NHI is going to help our people for equal health care access, but also quality health care. That's what we need. So we are going to do NHI. The NHI is going to save us. It's going to help us. I can see when you are fighting Amapek is a private sector. Your agenda is capitalism as nothing else. We are literally the Bretton Woods institutions, policies, as we spend less money on social needs. And that's what we are saying. We must spend less money on social needs. Private sector must do more. And we are not DA. We are not liberals, team. And we're not going to do that. We're going to spend money on our people and on social needs. That's why we're going to spend more money on health. Look at our budget in the province. It's education and health. Those are social needs. And we're going to continue with that. Because, Nina, you want to make sure the gap between a black person and a white person remains big. If we try to narrow the gap, we are saying, no, we must not spend money on such things. We're going to do it because we're closing the gap. And every day we're closing it. Honorable members, Chairperson, it is clear and glaring that to everyone that access to healthcare services in this province has improved a great deal under the leadership of the ANC government in KwaZulu-Natal. What the ANC has tabled to us today leaves no doubt that indeed we are on a mission. We are coming from an era before 1994 where in this country we had two healthcare systems, one for white people which had all the infrastructure and the best healthcare equipment, also very well funded. And we had one for blacks, which was totally the opposite of what whites were provided. About the Bura, the beneficiaries of that, they know very well at his age, he benefited in that system, and his parents and himself, they were quiet, and today they are starting to make noise. Because Amanda Bamnyama were not benefiting anything, they were going to hospitals that were underfunded, that were not proper. But today, the ANC has stopped that nonsensical system. It has put a system that allows everyone to access healthcare. In continuing with our mandate as the ANC government to change completely the picture of access to health, we found a number of hospitals that were built during the apartheid system by the NPA and KwaZulu government, the ZG, that were meant for blacks, others for white only. They were very small, with few wards, unable to provide some services. about trauma units, labor wards, we didn't have radiograph, we didn't have TB wards that are specializing today about MDR and others. But today we have changed all that. We have upgraded these hospitals, expanded them to be something else. This was all in the name of building access to health and a healthy nation and making sure that our people are accessing proper health. There's a hospital by uhulumeni waka-ZG. You know who was leading that government. If you go to CJM around, go to Bethesda Wanongom, you know how it was. But today, look at how it is. Go to Prince Mshien. How big is Prince Mshien today? It was built by ZG. It was small, but today it's massive because of this government of the ANC. And Chair, I want to say, you look at the clinics that we have built in KwaZulu-Natal, half of the clinics out of 608, 310 have been built after 1994 by this ANC government. Just in 29 years, 308 clinics have been built, and people will say ANC is doing nothing. That is primary health care. It's very important to our people. CCMDD, MEC, our people are able to access medication closer to their areas where they are living because ANC wants to make sure that access to health is there. But the CHC concepts, today we have built more than 22 CHCs in the entire province. And all that is to make sure that our people are accessing health. And the big, humongous, massive hospital called Pitney Isagagasem is going to be open. It's working. Today it's working. Thank you very much. ANC7.
Your time is up, Honorable Member. All the honorable members, ubalekela nimacheleza mngani wami. Honorable members, you remember the negotiations I had with my MEC, and she has requested 13 minutes for response.
Yes, Chair.
No, 13 mholo government business. You must not forget I was a maths teacher for 29 years in Mtombe. Okay, Honorable MEC, you are given the opportunity to respond.
Ngiyabonga kakhulu Sihlalo. Ngiyacela ukubonga kuma members onke adebateile, and I think I might not be able to respond to all of them. Kodwa laba bakhayo naba progressive, we have noted the points and we are going to attend to them. Chairperson of Portfolio Committee, we really took a guidance, and it is indeed a problem. It data center Solundi, and we are working on the issue of connectivity because iyahlupa. Ngiyafisa ukungena la kumhlonishwa uNkwanyana chairperson. Mhlambe ngikale khona. Uyabona Sihlalo, I've been accused of many things, but arrogance is not one of them. And in a portfolio committee meeting, lapho engibuzwa khona imibuzo kahle, I respond to questions, and I respond in a manner appropriate, and that befits a member of the legislature. Chairperson of the portfolio committee would never allow anything else. But Mkwanyane must ask me questions in the sense. If you ask me stupid questions, that's the response you're going to get. If you ask me silly questions, then that's the response you're going to get. The issues that she was raising right here are an indication of the kind of questions that she asked in the portfolio committee. They said, I must stoop down and come to her level. Not going to do that. Chairperson, I was elected to lead and raise the bar, and I will continue to raise the bar. If you want to lead at a level of the grass, I will not come to where you are. I will take you to where you are supposed to go, because I want to begin. You must lead and rise up to the occasion. If you don't do that, then don't drag me with you. It's not going to happen. If you want to and say I've been accused of this or that, I think Honorable Speaker has responded to that. Chairperson, there are processes, and I think Inkatha must be able to deal with that and raise the issue. one thing I am sure of, I do not approve any claims as the member of the Executive Council. There is absolutely no system in government that allows a member of the Executive Council to approve anything. Kodwa ke, if kunama accusations, then those they must follow in the proper and procedure elandelekayo. What is written on the newspapers, Chairperson, does not make accusation of anything. Ungathatha ke ukubhale phansi nabangani bakho emaphepheni, it doesn't mean ukuthi kuyiqiniso. Angikusho nje Sihlalo. Angikusho nje Sihlalo ukuthi kuyacaca ukuthi sinenkinga kunenkinga inkatha inenkinga nomhlonishwa ngoba if uthumela umuntu ongazi into okufuna yenze kwi-portfolio committee ugcina enza lezi zinto umhlonishwa uNkwanyane azenzayo. Mhlawumbe umhlonishwa uNkwanyane udidwa ukuthi ngoba sabantu abamnyama sithi nasikhuluma nabo simbize ngomama bese cabanga ukuthi she's going to walk all over us. We don't do that, and I'm never going to come kneeling to you. Anginayo mina irresponsibility yokuhlonipha ngiphoqoza isigqoko ngiphoqozela inkatha. I'm not a member of the IFP. Angaze ngaba a member yenkatha, so I'm not going to be treating you as such. I have my own leaders that I respect and provide guidance to, and those are the people I must respect. I respect you as a member of the legislature, and I will continue to give you that respect. Kodwa umuzongeisa hayi sizohlangana emgwaqweni dadewethu anginayo inkinga nawe. Chairperson, on Impilo Consortium, the fact that she does not understand the responsibility yakhe, she comes here and says, i-contract Impilo Consortium, iyanqanyulwa iphinde ivuselelwe. What kind of a contract enqanyulwa iphinde ivuselelwe? Uma ngabe ivuselelwe contract should kusuka sekuphela term of office. Just a clear understanding of a responsibility as a member of the legislature. Abahambe bayokufundisa, bayeke nanokukubhalela izinto ongazazi so that uthi una ukhuluma la wazi ukuthi ukhuluma ngani. Honorable Party, you know, the fact that you are saying now in this house, we must target 7 out of 7 hospitals. That's exactly what I said. That's exactly what I said. I said the target in the last financial year was 42 hospitals. We are now moving in this financial year to 42 hospitals, to 70 hospitals. What more do you want us to say? It indication that you came here not willing to listen, but you came here with what you wanted to hear. Despite of anything that we had said, you continue to say what you wanted to hear. But majority of the things really that you say were about you being a motivational speaker and quoting and making quotes. Not going to speak to that, they are immaterial, it doesn't help. But just for your assistance, there is no post in the Department of Health that is not critical. There's no point in the Department of Health that is not critical. A cleaner is as critical as a doctor because no doctor with their assaults will operate in a theater that is not clean, that has not been cleaned. So I think let's not score political points for us to be able to get votes. Honorable Nkwanyane uthe I must not campaign. Cha sizofika isikhathi sokucampaign angeke ngacampaign. I'm a member of the African National Congress. I sit here represent the IFP, the ANC the same way you represent the IFP. So you go and campaign with space sakho. I will do so. Usiyeke nje sicampaign ngendlela esicampaign ngayo, but in the legislature we talk about government. Honorable Bapti, you say we must go to a Western Cape. I think at some point, Governor in detail what the Western Cape has done and do for Black people in particular. Tina, I represent Black voters in KwaZulu-Natal, the same Black voters that do not get a service in the Western Cape. Chairperson, when you go to the Western Cape, they refused in writing to take Black students to Cuba to be trained as doctors. They refused. In this province of KwaZulu-Natal, we have more than 1,000 students that we have trained to be doctors. But not because they don't take the interest of Black people into consideration. They did not want to be part of that. But with their system, while their system only prioritizes people of color. So you want us to go there and reverse back to an apartheid time. That's not going to happen. When you talk about NHI, I am not surprised, Honorable Party, that you are going to complain and say NHI, Isholut, vele, EDA represents the interest of white monopoly capital. Vele EDA continues to be against NHI because NHI is going to affect imali that is received by medical aids. The people who are going to suffer the most when NHI is implemented are medical aid owners, and I am yet to see a black person who owns medical aid. I am yet to see. I am yet to see. Where Lentushan?
Honorable Dipur, we are pleading with you to have order, my leader. You know, when the MEC is responding and then you drown her, and then it will eat up her time and all the stuff, and then I will get accused. If we are having some issues, there are many avenues of engaging on the information that has been delivered in the House. But to drown the speaker so that he or she is not heard, I don't think it is the right thing. I'm just pleading with you, my brother. Can you continue, Honorable MEC?
Siyabonga Sihlalo, racist tendencies ga Honorable Tipo siyawazi awasithusi. He wants to intervene and indicate to his racist and white supremacist bosses abakhombisa ukuthi uma ela legislature ubathitha kanjani abantu abamnyama. We are not going to be subjected to that, and uzogcina ukwenza lokho kulabo benza kubona not kuthina. So I was saying Honorable Deputy Chairperson that we are not surprised ukuthi he thinks NHI is going to be effective because he represents the interest of white monopoly capital, who are the ones that are beneficiaries of medical aid systems and are the ones who are going to suffer when NHI comes in.
Can you hold on? And then you can relax and sit down. We hear that honorable member Osetelato. And please quote the rule that you are standing up on.
Honorable Chairperson, I rise on Rule 74 as I previously did. And I rise on Rule 74 related to the same member, the Honorable De Boer. The Honorable MEC has cast a reflection on the Honorable De Boer's integrity by suggesting that he is a racist. And Chairperson, I would like you to look into this and make a ruling in this regard. Thank you very much.
Will do so because your understanding is different from mine on what the MEC said. It's different. I mean, it's a question of listening and then interpretation. We'll do as you are indicating. Honorable MEC, can you continue?
Honorable Nkosi. Oh, okay, sorry. Honorable Nkosi Chair, I'm not sure ukuthi ngizokwazi ukuphendula because angimzwanga kahle. Mhlambe it would have helped uma ngabe bekhulume ngesizulu bese ngagcina understandani. Kodwa ke Honorable Sibiya uyiphendulile indaba ye-oversight nami engigcine ngizwile ukuthi ngathi kune confusion yoku-understand ukuthi yini oversight nokuthi ubani one-responsibility yoku-exercise i-oversight. Mhlawumbe ama-honorable members e-EFF kufuna acele kusomlomo njengoba khona laphana to get i-workshop enye on the responsibility of members of the provincial legislature. So angizokhuluma kakhulu ngempela kubona ngisho nje ukuthi kodwa when I go to communities so engayanga ukuye eralini yakwa ANC futhi I never go there ngiyithene ngenza irally yakwa ANC but sisuke sihambisa ama services esingeke siyeke ukwenza Sihlalo just because we are going to elections. We will continue to service abantu bakithi because the services that we take to communities are services that are much needed and abantu bakithi bayawa appreciate kakhulu. Honorable Sonjika, I think let's appreciate the support that you are giving on the e-health. And indeed, you are right. As the Department of Health, we need to start exploring how else can we utilize the technology as scenario. You are raising a very interesting point of exploring the option of consulting online with nurses or doctors is something that we might have to consider. You know, now that we are implementing NHI, by the way, we started implementing NHI, Honorable Babti, more than 5 years ago. So all the systems that we are implementing now, we are linking them to that. It's not like it's just say we are continuing. Hence, we are linking all the e-grant and all the other health workers that are there. Mhlambe, not that Mhlambe, Honorable Sonjika, we will explore this particular suggestion that you have through NHI and see ukuthi is it something that's doable. Sibone ukuthi kuphi lapho singaqala siyipilot khona. And uma ngabe singagcina sikwazile ukuyisebenza ngaleyo ndlela ngempela, it might really help when you consider abantu who end up going to esibhedlela or a clinic and wait in long queues for half the day when they actually don't need to do so. So uma ngabe singakwazi ukuthi si-implement, it might assist kakhulu. Ngiyabonga kakhulu kumhlonishwa uphakathi nomhlonishwa uManqele. Umhlonishwa uphakathi, I think he was also speaking to e-health as well and indicating what else is it that we need to do and guiding us on going to rural areas and townships. Sizokwenza lokho mhlonishwa, sicabanga ukuthi iyona guidance esifunayo. Umhlonishwa uManqele also spoke about that and indicated the issue of maintenance of facilities. Siyayinotha mhlonishwa, and a request that we decentralize EMS nama ambulances ethu lapho esiwabeka khona. Sizokubuka lokho sibone ukuthi kuyakwazi yini ukuthi kwenzeke, and will we continue to be able to manage wona ngalendlela okuyiyona yona nendlela ephokayo. Enye reason yokuthi ama ambulances abekwe at central points was because of availability yawo and because of number yawo. Kodwa we do know ukuthi ke kuthatha isikhathi eside kwesinye isikhathi ukuthi ambulance ifike eclinic noma esibhedlela uma ngabe ibiziwe just because ibase ayikho in that particular facility. One of the reasons why we are continuing to add EMS noma we are continuing to add imoto zethu is primarily so that we increase our numbers zama ambulances. So sizayibuka ngempela, and I think we are taking note of the fact that it takes long uma ngabe ingekho esibhedlela noma ingekho kwi health site, and we might have to bring them closer. So we might have to work around izinto or indlela yokuthi sikulungise lokho. Umhlonishwa uMavuso spoke in detail about indaba yokushoda kwe-staff in the department, and it is indeed a challenge, and we are hoping that ngelinye ilanga, when we get an opportunity to be granted a bit more money, we will be able to employ the staff that we need. Chairperson, uqinisile umhlonishwa uMavuso umethi ukuqashwa kwe-staff se-COVID-19 siya-eda kule staff esasivele sishoda. I-COVID-19 staff currently sisebenzisa as i-contribution towards the minimum staff establishment esasikhulume ngayo sangakwazi ukuqhubeka ngayo because of COVID. Kodwa as sibaqasha labo esasibathathile kwi-contract ye-COVID, we are then contributing towards that. Mhlonishwa uSibiya, hayi ngizobe ngiyona nje uma ngabe ngiphendula wena, but indeed umubuda i-infrastructure that has been built in the province of KwaZulu-Natal, ubheka ibhedlela esezakhiwe, ubheka ama-clinics aseyakhiwe pre-1994, sasingekho lapho. We were very far from that, but from 1994 kuze kufike namhlanje sidlulile ngo-300 in building clinics, and we are continuing to do so, and as long as sithola imali, we will be able to continue to build. Siyabonga kakhulu Sihlalo, ngiyabonga nangomusa wakho.
No, thank you very much, Honorable MEC. Thank you very much, Honorable MEC, and all of you honorable members. We really thank you very much for this a bit bumpy debate that you had. Unfortunately, the pilot was stable. That's why there was no crash. So, honorable members, we have now come to the end of the debate on vote number 7, which is the Department of Health of KwaZulu-Natal. I wish to invite the fellow presiding officer, Honorable TV Olu, to drive the program further Can we check where the whereabouts of Honorable TV Xulu to continue with our program? Babasha. Ngeke ngisuke kulesihlalo lesi ngoba isihlalo sobukhosi lesi. We intervene from the warring groups. That's what you do. So I can't leave it vacant. You will find everything in order, Mholwam. Thank you very much, Papa.
Good afternoon, honorable members. Can we now start with our next vote? Can we also have order for us to be able to finish our next vote? Honorable members, we will now proceed and deal with the debate on vote 14. Honorable members, I further wish to confirm that the budget report 2023-2024 of the Public Works Portfolio Committee has been tabled in terms of the visual rules. Presiding officer then proceeds with the debate on the vote. At the end of, it will proceed with the vote at the end of the debate. Then I saw a hand. Oh, okay. Then can we then proceed? Can someone assist us with the gallery because it seems to be a bit of a challenge? Please, gallery, let us proceed with our work. Thank you. Can we then now proceed with our report? We'll get the report by the MEC for Human Settlement and Public Works, Honorable Mahlaba, for 45 minutes. Honorable Mahlaba.
Maybe before I start, ngiyafisa engabe uDebulu wakhula nami. Honorable Chair, the leader of government business, Ms. Ntombeni, members of the executive present, Chair of Chairs, Oh, the Honorable Speaker is here as well. The Chairperson of the Portfolio Committee on Public Works, Honorable members, members of the public from the gallery, staff from the department, DG, and the acting HOD and the staff from the department, all the distinguished guests, receive my warm greetings. One, I want to start by saying, as a deployed member of the African National Congress, I stand before you in this august house with a sense of profound humility and a heart full of gratitude. Additionally, I continue to be unafraid to declare that the work at hand should be defined by a strong sense of infinity service, an unwavering willingness to serve at the behest of the electorate, first at all material times. As members of the African National Congress, as the government of the day, we serve at the behest of the members of the public, of the electorate. That is why at all times we respect them. That is why at all times we respect an august house like this. When we come here, we come prepared. We don't come here to howl, but we come here to explain the program of government. As a disciplined member of the ANC 411, which has been there for 100 years, I cherish, celebrate, commemorate the life and times of our fearless stalwart Umam Matikizela Mandela, who once said, and I quote, "I'm the product of the masses of my country and the product of my enemy." Umam Winnie Matikizela Mandela understood that she's not only the product of those who were behind her, but also the product of her enemies. That is why even today the ANC continues to grow despite its enemies trying to push it down. You are not a scientist, I am a scientist. I don't want to go back to what Mtomben said yesterday about grade 8. Winnie Madikizela Mandela's desires were solely built on the premise that a calling to serve should be an eternal one and lifelong commitment without a broken service. We witness and experience this unparalleled dedication to attending to the needs of others until passing of our gallant stalwart in the month of April. This is a very special month to us as the African National Congress. Madam,
Sorry, Honorable Masawa. Honorable De Boer, I don't think I will tolerate what you are doing. Please allow the speaker to carry on with the speech, please. I will not tolerate that. Thank you. You can.
Thank you, Chair. Honorable Chair. Though we fall short of emulating and walking in the footsteps of Mamu Winnie Mandela, we, however, unashamedly confirm that characterization of the KwaZulu-Natal Department of Public Works is embodied on the cornerstone that is its very existence is to make the life of ordinary South African easy and worthwhile. It is for this reason that we make no apology for wanting to champion the cause of improving infrastructure in the most rural parts of the province. During apartheid, we used to hear about service delivery only in urban areas. But since even during the government of KwaZulu, we hardly had. I come from a small village called Nkande. We never had water, we never had electricity until this Galat movement called the African National Congress came. I remember when I was young, we used to play with the electric switch because we did not know electricity. We'll just check whether it's working, we'll go hide behind the door in a roundabout, switch it on and switch it off and say, oh, it's working. But now it's a norm under the African National Congress. Because the aim of the African National Congress is to make sure that we improve the lives of our people from corner to corner. Through our efforts and cooperation with the sector departments, this government has brought appropriate infrastructure closer to our people. These unimaginable strides and achievements were once envisioned as a pipe dreams by enemies of progress and naysayers. This ANC-led government is forever cognizant that our sole obligation is not only to the few, but to all South Africans. Furthermore, our organization, which has deployed me to serve the people of this province, has bestowed upon me a greater task, which I have humbly accepted. This task, which was adopted during the 55th elective conference, entails that as a department, we pledge to prioritize vast and catalytic infrastructure projects. While my organization continues to hold the hope and trust of millions of ordinary South Africans, it is our sole responsibility as the department working in the built environment to increase the public trust in us by performing our duties in accordance with the mandate and expectations of the general public. In the same vein, the Premier has directed us not to leave anyone behind. From Manguzi to Port Edward, African National Congress presence has been felt. In all these areas, from Manguzi to Port Edward, you will find that everywhere there is infrastructure, it's because of this government of the African National Congress. If you go to areas like Western Cape, you'll only find it in Knysna and other areas. If you go to Langanyanga, Kaelicha, you'll find nothing. Our people are still languishing in poverty. They are still using bucket toilets. But the African National Congress has made sure that we leave no one behind, and will continue to make sure that we leave no one behind. Furthermore, the party which has deployed me to serve the people of this province has made sure that when we serve our people, we never ask them which political party you belong to. This fiscal year has been designated by the Department of Public Works as the year to intensify efforts to rekindle, to reinvigorate, and reinvent itself, working towards being the preferred implementing agent of choice. Hence, we encourage even our officials that all of us must make sure that even our sister department desires to work with public works. When the ANC-led government took the reins governing this province, chief on the agenda was the commitment to spearhead a program to give opportunities to previously disadvantaged individuals in the mainstream economy. and bridge a racial gap and managerial positions in senior department units. Before it was only white males followed by white females. But today, we can even make an example with the Department of Public Works. Top at the echelons of the department, most of the senior managers are black, young females. It's because of the African National Congress. It was in the month of April when the former president of the ANC, Pixie Zayakaseme, said that, and I quote, "The African has refused to camp forever on the borders of industrial world, having learned that knowledge is power. He's educating his children." With these words, he meant that we must make sure that we don't give, especially our black people, crumbs. They must participate. And you can see that this is a government that is speaking with one voice. We have one message, but in one voice. Yesterday, when Honorable Mtombeni was delivering his budget vote, he spoke about bringing our black people into the mainstream economy. The same thing we're talking about. When you go to what was called Russell Street, you'll hardly find a building owned by a black person. That picture must change. Because in this is the call which, as the department heeded, and we have allowed previously disadvantaged South Africans to thrive and succeed in the built environment. Honorable Chairperson, we have deemed this year as a year of massive job creation. And bakithi ngifisa ukusho ukuthi sihlela ukwandisa amathuba emisebenzi elinganiselwa ku-17,500 esifundazweni swethu. Lamathuba emisebenzi azovela ohlelweni lokwakhiwa kwengqalasizinda. Amanye amathuba emisebenzi angaphezulu kuka-135,000 azovela ohlelweni likahulumeni olubizwa nge-EPWP. Uhulumeni we-ANC okwaziyo ukuthi abantu bayanakekelwa. Ngizwile la mangifika umunye ethi kuyakhampenwa. Bahambe bayakhampena lapho uma bekhuluma. Mina unashamedly, I'm a member of the ANC. When I speak based on the manifesto of the ANC, which made people to have hope in the ANC and vote the ANC, and I will continue to do so. Our department is about 3 programs. I will start with program 1, which is administration. We set aside about 448 million. Then the main objective of this is to provide strategic leadership, overall management, other areas of responsibility, including supporting executive authority, building a positive corporate culture, rendering support and advice in terms of human resource and legal matters, communication and effective use of digital infrastructure, ICT, are other key focus areas under this program. Ngoti le gaywa phansi ICT lenje. The program also ensures monitoring and evaluation systems are in place and renders sound financial management services, risk management, supply chain management. The program's budget is distributed as follows: compensation of employees 346 million, goods and services 92 million, transfers and subsidies 6 million, machinery and equipment 3.5 million. In terms of strengthening service delivery capacity, it is importantly, importantly, last year, we committed ourselves publicly to build an image of clean governance inspired by our determination to ensure that we work with both agility and speed. If a project is supposed to take 12 months, if we work with agility and speed, we are going to complete it within that time. That is one thing that, as this department, we've set ourselves. We're committed to build on the foundation we have laid by filling vacant posts as a way of strengthening service delivery. A concerted effort in recruiting necessary capacity has since yielded significant results. Honorable members, in 22-23 financial year, the department has filled 5 senior management service positions and also filled 44 posts in various positions. The current human resource provisioning plan contains 159 approved and funded posts to be filled in this financial year. Because we want to make sure that we have no excuse in terms of delivering services on time. In terms of good governance, Honorable Chairperson, we are strengthening our working relations with provincial treasuries, internal audit, and Premier's forensic investigating unit. We continue to ensure consequence management by dealing with cases of fraud and corruption. This year, honorable members, our reports indicate that there are 17 forensic investigation cases, and 6 of these cases have been finalized. Again, we also report satisfactory progress with implementation of recommendations working with all law enforcement agencies. We'll continue to investigate fraudulent and corrupt activities without fear or favor, because we have a strong conviction that each cent of taxpayers must go towards improving their well-beings, not anywhere else. We also committed in ourselves in terms of skills development in line with government policy. The priority will prioritize youth development, creating and maintaining a capable state. Department thus far awarded 68 internal and 39 external bursaries to students pursuing various degrees in built environment and other fields related to functioning of the department. Because as the African National Congress, we prioritize education. We don't want people to just end up in grade 8. We want to make sure that we give them bursaries, and we don't choose which party you belong to. We encourage also members of this house to apply also, because we want to make sure that they improve themselves. Bob Mandela said it is through education that a sign of a mine worker will become the president of the nation. Hence, we've awarded these bursaries. Our internship program has produced 69 registered professionals so far. Internship programs, 69 registered professionals. Currently, the department has 45 interns with built environment qualifications such as engineering, quantity surveying. We will tap into them once they are qualified. We also want to make sure that we improve the lives of our people. Interdepartmental accounts, Honorable Chair, I wish to report that there is an improvement in terms of settlement, in terms of dealing with this challenge. However, there are still departments which are lacking And we humbly request leader of business government that we encourage all departments to make sure that all of us will cooperate so that we don't destroy our own implementing, our own implementing of choice. This will enable the department to honor payments to service providers within the prescribed 30 days of invoicing. We mustn't be the one where Mtombeni, your department will start a business. You fund them, you put them in an incubation period, they start working, and then we destroy them with payments. They must be paid within 30 days. So they don't accrue interest. We must not be like pigs which eats their own children. Because most of these millionaires that you see today came because of the African National Congress. You must not destroy them. In terms of program 2, which deals with property management, Honorable Chairperson, the purpose of this program is to provide and facilitate the provision of office accommodation, integrated property management services to clients through planned property life cycle, acquisition, management, maintenance, and disposal. Optimal utilization of immovable assets, land evaluation, maintenance of fixed assets, register payment of property rates, and integrated service delivery. Program budget is distributed as follows. Compensation of employees, 66 million, goods and services, 56 million, transfers and subsidies, 715,000, machinery and equipment, 0.28 million. Immovable asset register. Honorable members, the department manages immovable assets with an estimated value of about 25 billion. The department continues to maintain accuracy and completeness of the provincial immovable asset register in line with National Treasury minimum requirements. Immovable asset register is continuously reconciled with various data sets from other institutions such as Deeds Office, Office of Surveyor General, Municipal Board to achieve data integrity. Property rates. This let me speak not from the script, but from my mind. The department is underfunded when it comes to property rates. It's all the time is underfunded by more than 300 million, which makes it difficult for the department to pay the rates, and the non-payment is jeopardizing the good relationship between provincial department of public works and the affected municipalities. On this note, we request that the provincial treasury continuously, as they've been doing, to support us with this matter. Maintenance of state buildings. It is concerning fact that maintenance of state buildings remains unsatisfactory. The department acknowledges the insufficient budget allocation towards improved maintenance of state buildings. To this end, the department is working closely with provincial treasury to explore other possible means towards this challenging task. In terms of planning going forward, 2 strategic buildings, namely Esplanade, which is here in Durban, and Karelandman Street in Dundee, have been identified for public-private partnership. It must be noted that this is a lengthy process. However, the plan is already in motion to realize this soon. It must be mentioned that due to inadequate maintenance of these buildings, there are buildings that remains unutilized as their condition is dilapidated. As a mitigation plan, the department is finalizing the immovable asset utilization strategy to ensure that these are utilized for economic development and revenue generation for the province. As part of this strategy, the assets have been categorized for the following uses: letting of prime sites and vacant land, repurposing of some immovable assets, human settlements as a contribution in respect to flood damages, residential accommodation to some of the local municipalities. As members of this House, we are aware that when government of the day assumed control of the failing apartheid system, we not only inherited an eyesore site, but also structures that were unfit for human habitation. We chose a sustainable development renovation strategy for these public buildings. As a result, we realized that remodeling buildings has a great potential for energy consumption reduction and promote the use of other sustainable remodeling concepts such as protecting environment and the health of the economic of the community through exploring renewable energy. It's been a long song that we must deal with renewable energy. It's something that we are exploring. We've also started with conditional assessment of these buildings. The purpose of this is to assist the department to determine the condition of its facilities, which will form part of its planning on the outer years. In this way, preventative maintenance could be done timelessly rather than costly rehabilitation. Secondly, assessing these facilities on an annual basis, it will assist the department to maintain the completeness of the asset register. This is in line with the provisions of Government Immovable Asset Management Act 19 of 2007. The department is planning to conclude 414 assessments in this current financial year. Provision of building structures, equipment, we've set aside 450 million. The main purpose of this program, which is program 3, is the erection, acquisition of building structures, engineering works, maintenance of buildings to client specification. The core services are improving integrated service delivery in the provision of buildings, creating of jobs through EPWP, because EPWP workers are not people who must use just as a lead pickers. We must skill them in a process. As we maintain government buildings, they must be part of that. Because at the end of their journey, they must come out with something which will make them to start their own business. Department of Economic Development is there to assist, to make sure that they are able to start their own businesses. Those who choose the route of employment, they are employable. That is why we must not only use them just as lead pickers, but you must put them strategically where they must work on the leaking pipes. We must put them there so that they gain necessary skills. The program budget is as follows. Compensation of employees is about 328 million. Goods and services, 104 million. Transfer and subsidies, 2 million, buildings and other fixed structures, 14 million, machinery and equipment, 1.4 million. As many people are aware, the ANC has been pressed by critics regarding its plans to maintain and expand upon the infrastructure. Since the very inception of democracy, the organization has maintained its stance and position that it will pioneer the comprehensive, all-encompassing approach to pressing socio-economic issues, including the provision of infrastructure. Honorable members, I'm pleased to report that our quest to become the implementing agent of choice in the province in the 6th administration, the department has completed 1,273 capital projects across the province in this 6th administration, investing 5.5 billion. Some are saying, what has happened? I think they live in another province or somewhere. In the Department of Health alone, although I won't go to figures, go to Clearwood Hospital. Over 200 million was put there. Catherine Booth Hospital, 97 million. King Dinuzulu Hospital Complex, which is a state-of-the-art, 104 million. Mosport Hospital, where no one dare to go to. This government of the African National Congress put about 46 million to make sure that it's in the good condition that it's in. And I'm glad to say even medical students now are taken there to be trained. It's because of the African National Congress. St. Francis Hospital, there are many to mention. Department of Education, you go to Mahlabeni, Lower Primary School, 49 million. Nanda, for learners with special educational needs. ANC, because as the ANC were the government that cares, we've put about 218 million for learners with special needs. Kanti junior secondary school la ingane yashawa khona inyoka ngoba yayifundela emaklasini afile, yathi seklasini nje inyoka yavela ngekhanda yayishaya ingane. ANC has completed that project. We put about 57 million. And that is one of the state-of-the-art schools. If you go through Dandi, as you exit Dandi towards Blood River or Ngutu, deciding which way you are going to, you will see it's on your left. It's very beautiful. It was built by the African National Congress. You go deep down there in Kokstad, kwesikanobhala wami uDlangamandla. Isikole uxoloxolo ungafunga uma ungavala amehlo uvule ubuzwe kuthiwa kuphi la uzothi usemhlanga kanti le eKokstad. It's a state-of-the-art school. ANC government invested 69 million to make sure it's in that condition. There are many other portfolios that I will not mention where the African National Congress in all other districts, government of the ANC has made sure that we invest. An example is a conversion of a government garage here at eThekwini into office accommodation under the Department of Social Development. We invested about 124 million to convert a garage to office because it was lying idle. Honorable members, 207 schools across the province have benefited under water and sanitation program. Many of our kids were falling into pit latrines, toilets. But the African National Congress intervened. So far, 207 schools have benefited from that program. We did not only leave it to that. There was a challenge at some point at Umsinga Hospital where the district was failing to provide water. We decided that we are going to go and drill a borehole. Today, that hospital will never run short of water. So far across the province, we've drilled about 504 boreholes, which are benefiting our people. We've commissioned a total of about 190 generators in various clinics and facilities across the province, so that even when there is load shedding, our clinics are not found wanting. This is the government of the people, by the people. This is the caring government. This is a government which listens. By the way, we listen even to the opposition, because Oliver Tambo once cautioned us that you must also listen to them, because you might learn one or two things, provided they are coming with something constructive. We'll take it. You are welcome. Asikhethi phela emasini, angisho ukuthi ngamaphela. Isizulu leso. Asikhethi phela emasini. Right, IFP, DA, EFF. Uyazi umfowethu phakathi babumanqele. Uma besifonela siyaphendula. Nabe IFP bayazi. Indawo nje ngingasho esesike sasebenza kuyo kakhulu kula phezulu land. Ngiphethe IFP, asisho ukuthi ngoba kuphethe IFP ngesiye. Emzinyathi sifike eQathatha. Chief Whip Mbingelele. Sifika yonke indawo from corner to corner. Ube kwakuseAfrica bengizo from Cape to Cairo. Kodwa ngoba sila ngizothi from Manguzi to Port Edward. Sifike eQathatha. Ngole masondo sondo. Woolman we-ANC. Under the asbestos eradication program, 52 health facilities across the province, we've made sure that we eradicate asbestos roofs under all these 52 facilities. This is the government of the ANC at work. Honorable Chair, going straight to EPWP, Public Works is responsible for overall coordination of EPWP. The province has been allocated overall target of 643,269 work opportunities for phase 4 of EPWP. And we've achieved 592. We are sitting at 92% as the achievement. And we are sure that we'll get to 100%. The department will continue to provide technical support to all provincial departments. In terms of green building, alternative energy saving, the department is engaging with Department of Mineral Resources and Energy on the implementation and rollout of energy performing certificates for all state-owned offices. Therefore, will require the cooperation of all departments so that we save energy. In terms of building the provincial government precinct, the provincial government precinct is steaming ahead, and statutory compliance requirements and funding models has been completed in March 2023, while the concept for the office blocks are targeted by April this month. DPSA has been brought on board provincial treasury to explore various funding models so that we achieve this. We're also focusing on vulnerable groups, which are women, youth, people with disability, military veterans. And one of our targets to make sure that in terms of women, we achieve 45%, 35% for youth, 10% for people with disability, and 10% for military veterans. I had one of my colleagues sitting this side one day asked, why are we prioritizing these military veterans? They fought for the liberation of this country. We will not leave them behind. As we speak, Honorable Chair, 20 youth who were part of the EPW program have started learnerships from the 3rd of January this year and will be enrolled for a period of 12 months. And at the end of 12 months, the learners will obtain accredited certificate of competence from SETA. Not on by nje, bazothola an accredited certificate from SETA. We are also busy with Umkungundlovu Entrepreneurial Center of Excellence. Refurbishment has been completed. We're in a process of procuring working tools. Then we have a program called ASI's Contractor Development Program. Honorable Chair, to date, about 632 projects have been awarded to 512 emerging contractors, because ours is to build our people. It's not just lip service, but it's practical. Riyasebenza. They normally say sleeping on duty is a dismissible offense. We are not sleeping on duty, we are working. A total of 312 contractors were trained in various skills, including filling of bid documents, pricing, construction management, so that they bid successfully when the time comes. In closing, I would like to express my heartfelt appreciation for the exceptional dedication of the department's devoted team of technocrats as department. We must play a crucial position in enhancing the fortunes of our province. Overall, in addition to my ongoing commitment to improve the lives of the ordinary South African, acting HOD, Mr. Machola, senior management, and all categories of staff at the head office, in the department, district, regions, your zeal and commitment to serve has not gone unnoticed, and for that I'm grateful. I want to express my gratitude to the Honorable Premier, Ms. Nomsa Dube, who has taken a time to comprehend and embody our department's mission. To my colleagues, members of the Executive Authority, I make a commitment to be by your side as we go forward on our mission and pledge to have a significant influence throughout the province. To my organization, the African National Congress, I want to thank you very much for giving me this opportunity to serve my whole family, especially my loving, beautiful wife. She's sitting there. She's a pillar of my strength. Sometimes when I'm tired, she's very beautiful. Yes, that is why I emphasize that. Lastly, and most importantly, I want to pay tribute again to Ingole Masondo, the African National Congress. I'm forever grateful, thankful for affording me the opportunity to serve the residents of our province. With that said, I table the budget vote 14 of 1.7 billion for consideration and approval by these honorable members of this House. I thank you.
Yeah.
Dokotela, siyabonga. Dokotela wombutho.
Thank you, Honorable Mataba.
You were definitely on time. Our next speaker will be the chairperson of Public Works, Honorable MPP Zungu, for 10 minutes.
Thank you, Honorable Chair. Greetings to all members present in this August House. All our guests. House Chair, we are delighted as the Public Works Portfolio Committee to take part in this 2023 and 24 budget debate for vote 14. By and large, the committee is interested in the topics that were mentioned by our Honorable MEC, Dr. Mahlaba. It gives me a great pleasure to inform this House that the committee makes sure that the stakeholders are involved in its committee and legislative processes, since the department has committed to the following annual oversight plan. It is for this reason, House Chair, that the draft of the 2023 and 24 APP and budget for the Department of Public Works was considered at a public meeting with stakeholders on the 24th of January 2023 in Harry Gwala District Municipality. It pleases us to know that the core business functions of the provincial department are in line with the outcome-based strategy, goals and objectives in the 5-year strategic plan that started in 2019 to 2023 of the Public Works Department. In terms of budget, Honorable Chair, the department presented the 2023 and 24 annual performance plan and budget for consideration. The reproach budget allocation for 2023 and 24, which is 1.7 billion, which has the program structure, program 1, hotel and administration, that has a 25.79% of total budget, estimated at 448.489 million. Program 2, property management, with a percentage of 48.27 of total budget, 839.476 million. No, program 3, provision of building structures and equipment, with an allocation of 25.93% of total budget, 450.999 million. The committee will monitor all these programs that we've mentioned above as they form part of committee priorities. The committee therefore expresses its concern the department implemented budget cuts of 22.57 million in the financial year of 2023 and 24. Hence, this is going to have a very negative impact on the three mentioned programs. The committee therefore noted, in respect of 2023 and 4 budget, the following: that the largest share of the department's budget is allocated towards personnel. That is compensation of employees, a comprise of 43% of the department's budget for 2023 and 24 financial year. This budget item is key cost driver in achieving the department service delivery mandate, the provision of infrastructure support, which entailed the portfolio committee noted that the budget cuts of 22.057 million were implemented entirely against the program 2, which is property management. That the committee notes with concern the conduct of some client departments that compel the public works to deviate and contravene the legislation in terms of the payment of service providers within 30 days. According to SCOPA and the AG's report, the public works reflects as non-compliant due to being owed by client departments. This program focuses mainly on public property rates and the implementation of Government Immovable Assets Management Act, and Fixed Asset Register project. Due to the budget cuts, the department expects to have a shortfall in the payment of municipal property rates in 2023 and 4 financial year. The committee is mindful that the department will have budgetary pressures in respect of property rate payments, and this might require additional funding.
as the program 3 caters mainly for infrastructure projects as well as improving infrastructure in support of the committee. Noted the budget over the 2023 and 24 midterm expenditure framework reflects a steady growth. Lastly, Chairperson, the committee was encouraged by the continued upward trend in the department's budget over the MTEF period, notwithstanding the budget cuts. While the committee notes with concern reduced budget, the department's focus over the MTEF will be on the following: the delivery of building, infrastructure and accommodation, extended public works programs, extended public works school maintenance program, EPW provincial, coordinating and monitoring, and lastly, the building condition assessment. The committee was very much encouraged that the Department of Public Works is determined to contribute towards the elimination of poverty in reducing inequality by creating employment through radical service delivery. This was evident in various construction projects that are managed by the department, such as the Kolokolo Senior Primary in Herigwala, whereby the project created about 160 job opportunities for the local community. Indeed, Chairperson, the honorable members from all parties supported the budget, where we have our members from ANC, IFP, DA, EFF, ACDP. They're all in support. In conclusion, Chair, I want to take this opportunity to thank the MEC for Public Works, Honorable Utokotelo Mahlaba, honorable members of the portfolio, the acting HOD, Mr. Majola, and his outstanding team for their perseverance and cooperation. Chair, I wish to express our gratitude to former committee members who have since been deployed to the executive positions for their contribution. And lastly, Chair, to the AG's Office, Treasury, and the KZN Legislature, its support staff, for the continuous commitment in ensuring the efficiency in our operations. Siyayiseka kakhulu, sibonge kakhulu, Hlalo, sibonge nombutho osithumile ukuthi sime la. Siyabonga.
Thank you, Honorable Zungu. Our next speaker will be Honorable S.W. Mshengu of the ANC for 9 minutes. Honorable Mshengu.
Okay. Oh, okay. Thank you. Thank you very much, Honorable Chairperson, Honorable Member of the Executive Council, Leader of Government Business, Mtombeni, MEC Mahlaba, MEC Moloi Dadwetu, Honorable Members, Acting HOD and officials, Honorable Members, ladies and gentlemen, good evening. It's 6 o'clock. It was on this day, Honorable Chair, when the most revered leader of our people, Comrade Christian Msiliani, was buried. I say this, Honorable Chair, against the popular belief that when people, no matter how they died, it is presumed that they are resting in peace. It's been 30 years of agony for his family and the broader Congress movement, because we believe that we are yet to know those who ordered the hit on our leader. Comrade Dani believed that the wealth of this country must be shared by those who work it. Comrade Chris believed, as we do, that no child must learn under the trees. Elderly beneficiaries of social care system by the state must be provided under dignified conditions. Honorable Chairperson, the concurrent obligation of this department, amongst others, is to serve as the custodian and management agent of all state movable assets. This is done through coordination and monitoring infrastructure programs in respect of client departments. The development of the infrastructure master plan is an innovation and progressive initiative that seeks to align the district development model and the centralization of government services for the ultimate seamless coordination and accessibility of government closer to the people. This initiative of the ANC-led government seeks to redress the apartheid spatial planning and provision of government facilities along racial lines. Chair, both the erstwhile KwaZulu government and the white minority government were never about the people, but about self-preservation. This master plan, or members, considers road and water as well as sewage infrastructure, considers telecommunication and energy supply, thereby ensuring that newly built facilities are going to be sustainable, user-friendly, and of low maintenance cost. Honorable Mahlab, what have you done now? Honorable Chair, throughout the province, new modern schools, state-of-the-art health facilities, new libraries and museums, social development offices and tribal authority courts stand out as light and darkness, as such iconic and life-changing structures inspires our people that they too deserve facilities of highest standard irrespective of their socio-economic status. Omunye umhlonishwa uthe kimi nakandlwana kuyakhanya, nalapho kungekho khona kude kuyasa. The professional capacity of this department has to undertake design and other technical outputs have significantly reduced the over-reliance on consultants, thereby saving the public pay a sizable amount of money. Honorable Chair and honorable members, it is undesirable, and I want to repeat this, it is undesirable for a government to provide an essential service using a private facility. Asikufisi ukubona an essential service being provided kodwa isekusetshenziswa ama-private facilities, because there is a tendency of these service providers to frustrate the services to our people. Honorable Chair, the legislature visited police stations, or rather, let me start here. We remain concerned with the number of unused pieces of land and buildings that belongs to the state and on the inventory database of the Department of Public Works, which cost the government huge sums of money in terms of rates and services. As means of further enriching the infrastructure master plan, we call upon the department to ensure that in each district they compile a comprehensive list of such pieces of land and buildings, as others are already hijacked by criminal syndicates. Schools that are being decommissioned, Honorable Sonjeka, must equally be repurposed in order to prevent illegal occupation. The legislature visited police stations in the past few months, and the conditions in some were a shame, to say the least. We wish to implore the Provincial Department of Public Works to engage the national counterparts, or rather their national counterparts, on how can they collaborate in maintenance agreements for such critical facilities. A significant number of such police stations are using old, debilitated private houses owned by white liberals who are not even prepared to improve the conditions of such buildings, but only interested in huge rentals. These arrangements were designed to benefit the white supremacy, as such police stations are not even accessible to the black majority found in rural areas and our townships. Chairperson, the post offices have closed a number of their buildings that could be repurposed to benefit government and the people. I wish to further implore the Department of Public Works to undertake a needs analysis in such areas and make proposals to the relevant minister in order to make every available bidding to the benefit of the people. Honorable Chair, we applaud and welcome the decision of our Premier, Honorable Nomsa Dwengube, in her budget vote, who directed that the department must, with immediate effect, resume the implementation of JEZE barriers in order to secure our northern borderline with Mozambique. We hope that this, given the reputation of this department of being an efficient and competent agent of excellence, that's my invention, although you call yourself agent of choice, this mandate will be executed with agility. Honorable Chair, in 2022-23 financial year, the department completed 116 capital projects with a total value of little over 775 million rand. In this process, honorable members, 135,238 jobs were created. This proves that public works is not just an implementing agent of choice, but a creator of local opportunities of note. The ANC believes, honorable members, that public works remains one of the most important departments of our government as it enters into contractual agreements for office space for all user departments, providing critical service for the benefits of the people's government. It is this background, or it is on this background, Honorable Chair, that the issue of a state construction company must continuously be explored as we lessen our reliance on the private sector to build facilities for the government. Such will serve as an infrastructure institute that will provide in-service training for engineers, architects, and all professions in the built environment. The professional fees charged by some of the private sector for the construction of facilities amounts to exploitation of the masses, as such exorbitant fees fits their lavish lifestyle. We must develop our own. The ANC supports this budget vote. Thank you, Chairperson.
Thank you, Honorable Shengu, once again on time. Our next honorable member, it's Honorable TP Mtetwa of the IFP. She has 5 minutes, but she's going to do both fives, and then it means now she'll use her 10 minutes. Thank you. You can take the stage, Honorable Mtetwa. Thank you.
Thank you, Honorable Chairperson, Honorable MBCs present, and Honorable members. Mhlawumbe ngisho ukuthi yazi mengime la inhliziyo yami yasho ukuthi ngiyaziqhenya futhi nginokukhulu ukujabula ukuthi I'm representing iNkatha Freedom Party. Inhlangano yakhandwa indoda eyayithunywe yaxoxisana nabaholi ababephila ngaleso sikhathi. Bathi hamba uyokhanda lenhlangano. I'm so proud ukuthi the ACE KwaZulu government yakhe iy'kole over 5,000 in a very short space of time. Yakha amaklinikhi, yakhe iy'bhedlela. I'm the product of abantu mina. Noma I cannot say Mosvold to me is something eke yangihlupha, because although yakhiwe ngalesa sikhathi iy'ngane zami zonke nje ngayideliver eMosvold futhi ngeke ngikushintshe ukuthi ngizalwa eNgwavuma. I'm so proud ukuba ile nto. Ngiyazi ukuthi abantu abaningi ke babecabanga ukuthi umulahle umuntu uzomisa eNgwavuma, but that was not the case with us, because we're born there and we're not going to say kubi, but I'm happy that there are improvements in the areas where I'm coming from. First and foremost, my leader taught me to speak the truth, even when it is bad. And then he said, go there and be an opposition, but in a constructive opposition. But I don't want ngempela ukuthi ngiyangathi esingakwenza ke ngabe uyazenzela, but umntwana uthi be a constructive opposition, but don't hide the truth. Uma kuyiqiniso ungasala wedwa. Hayi ke ngiyayithanda ke lento. That's why when I come here looking at issues that is Sethembe, I have to, for his sake. First and foremost, I would like to extend my deepest gratitude for the opportunity to stand here today and represent the IFP in this important debate, to try and advance the lives of our people who entrusted us with the position we are holding. Honorable members, the IFP welcomed the allocation of 1.7 billion for the 2023-24 financial year, given that this department is a crucial in this post-apartheid period, because it is the custodian of public asset comprising of immovable property, land, and other assets. The department holds these assets in stewardship on behalf of the people of this province. It is therefore important that the department carries out its mandate in an efficient, effective, transparent manner, as expressed in its vision, which states that the department is committed to being, then I quote, a service-oriented department that delivers value and contribute to the national agenda for social and economic development. In this financial year, the department is managing an allocation of 39 million as part of the EPWP mandate. We note that the department set a target of creating 135,000 work opportunities and 62 full-time equivalent during the 2023-2024. Siyalweseka lolu hlelo. Siyafisa futhi ukuba lusabelaliswe ngendlela engenakho ukucwasa ngokwezinhlangano, futhi sicela kube nesiqiniseko sokuthi abantu abakhubazekile nabo bayanikezwa amathuba. Senyuke isibalo but I've seen ukuthi there is 10%. Ngiyafisa MEC sengikuzwile ukuthi ukhuluma indaba ethi akucwaswa ubhekisise because wena uzokhuluma but uimplementa akusiwena. Uma ungaya kwezinye indawo ama EPWP programs are not used as per wena usho. I think if you are saying let us be transparent, sisebenze ngendlela eyosiza wonke umuntu ompisholo eSouth Africa, kuyodingeka ukuthi sikubhekele eduze ukuthi ngempela kwenzeka kanjalo yini, ngoba angifuni ukumention but I can mention uma ungaya kwezinye indawo this thing ishintshwe ibe ngenye into ngabantu abathize. Honorable members, we are concerned that the department has been unable to fulfill some of its objectives. Last year, the department set a target of 5,123 work opportunities. And I wonder how many job opportunities were created, but I've heard, but it was not 100% fulfilled. And also, if you look at the target, this time, the target is lesser than the previous year's target. I don't know what informed the changes from 5,125 to 135,000. Then check and check what is it that informed the department to change the number instead of increasing, and then they decided to go down. Honorable members, furthermore, the Bali Bridge project was expected to be completed by March 2023, but due to certain challenges, the completion date was extended to late 2023-2024. Condition assessment of 150 facilities that were planned for 2022-2023 for state-owned office accommodation in respect of all departments remain outstanding, and we are told that the targeted facilities will most likely be achieved in 2023-2024 because of the discussion with provincial treasury to assist in identifying the facilities and are still ongoing. Moreover, with regard to Izanda Ziyagezana program, we were told that the department had planned to expand this service to schools in addition to vacant sites, but this did not take place. I could go on and on with many promises. I want to pause here, MEC, to say, when I arrived here, 2013, there was a project of over 89 million of an aperture in Wavum. That project once visited, I think it's early 2020, where we saw that it has stand still. And then the Department of Agriculture, they are saying it's public works, and public works, they say issue is about a specification. Who is supposed to finalize this thing, and when are we going to get that project finished? Because it is now going to be vandalized by communities. According to the Rules of Finance Management Act, all departments should have spent at least half of the budget after 6 months. And according to the 2024 resolution, there is no money that should be going back to the National Revenue Fund, as this denies our people many services and opportunities that are entitled to. Nevertheless, government departments are not always successful in following the rules. With that being said, the IFP is also concerned that the back and forth blame games that are taking place in government department, which is clear indication that there is an unaccountability deficit. I want to say here that when you go to public works, they will say we're waiting for money from education. Then education will say, oh, the project is not finished because of public works. I think this must stop. And there must be time frames where people are going to finalize most of their things. As the IPO acknowledged that the department has appointed security for the buildings that are not yet occupied to ensure that buildings are not hijacked by those who want to occupy them illegally. And we further acknowledge that the presence of security personnel will ensure that these buildings are not vandalized. Kodwa siyafisa ukuthi kube nama-time frame lamabhilidi ngempela akasetshenziswe anikezwe umasipala akwazi ukudevelopha abantu bakithi kube nako ukuthi as from now mhlambe sizothatha isikhathi singaka then i-build is handed over to so and so that is going to use that building then to allow ama-building sikhokhe inkece sikhokhela amabhilidi abantu abagadile kungenzeki lutho kuwo. With regard to the construction of the parliamentary precinct, the IFP position is known. We are.
Thank you, Mhlonishwa. Your time is up. Thank you. Thank you. Thank you, Honorable Mtetwa. Then our next speaker of EPA, Honorable M. Ne, for 8 minutes. Thank you.
Madam Speaker, Chairperson, honorable members, greetings to all. Honorable MEC, you have attributed all the successes you listed today to the ANC and not government as a whole. Likewise, the ANC must take full responsibilities for all the failures as well. It has been said that true success is not in celebrating one's successes, but in acknowledging one's failures and celebrating them when you've overcome those failures. The conundrum today is whether public works is the one to blame for failures seen in all other government departments or the scapegoat which is blamed for other department failures. Let's take a closer look at KZN's implementer of choice. The department which has been battling to stay afloat now has its life jacket ripped away with a massive budget cut from 1.9 billion to 1.7 billion. And as if that was not bad enough, gasping public works will have a sinker in each of its pockets to pull it down even further. The first sinker is a 10 million rand cut, which will go towards job creation. And the second sinker will be another 10 million rand cut taken for crime fighting. This all while schools and other government buildings have been disconnected by municipalities because of non-payment of their property rates by none other than the Department of Public Works. Now, the program that deals with these rates, property management, also gets a massive budget cut. This whilst municipalities' rates tariffs are increasing. It simply makes no sense. Municipalities are really struggling, not because residents are not paying, but government. With a budget like this, It's as if we are expecting MEC Mishlaba to work a miracle, something like turning water into wine. But seriously, this department does not need a miracle. It needs bold, good governance. Now, apart from not being able to maintain other government department buildings, public works are not even able to maintain their own offices and have also been subjected to disconnections. It's not a good story to tell. The reality is that government buildings are falling apart, yet the property rates owed on these are on the increase and accumulating. Those thousands of government-owned buildings that are lying empty and dilapidated, that you are unable to maintain, have got to be dealt with, especially in eThekwini. Derelict buildings are a massive problem, and most of them are government-owned. They are a health hazard, and many are a hideout for criminals and their criminal activity. Now we want to take 10 million rand from public works to fight crime, when we can just do our part for crime by dealing with these buildings. The buildings cannot be maintained, and the department has difficulty in finding people who meet the criteria to be able to lease these buildings. Instead of leaving them to deteriorate or be invaded, why are we not leasing them? Why are we not donating them to non-profit organizations that are in dire need, or selling them to anyone of any race who have an interest in buying them and maintaining them? And those who require funding should be assisted. They should get some guidance toward funding access. The fear of government property making its way into the hands of, as the department calls them, previously advantaged people, is crippling this department and our province. If we continue dragging our feet, soon there will be nothing left to sell. You have had almost 30 years as the custodian of government property, which has brought us to this embarrassing point in time where you can't manage them anymore. The writing is on the wall. It's time for a new government. Approximately 1,000 informal settlements in KZN. How many of these are on government-owned land? It would be interesting to find out. And whilst this department struggles to generate revenue, our parliamentary houses in Ulundi are occupied by so-called tenants who have no lease with the department and do not pay any rent. How did this happen under your watch, ANC? And who knows which other government property is being occupied for free? There's got to be an audit on our properties, and who knows, we might find some surprises, like the house lease to the Mzunduzi speaker. Now listen to what the Finance Portfolio Committee had to say to Public Works at the MTF budget hearings. I quote, "The committee urges the Department of Public Works, as the implementing agent of choice in KZN, to increase its capacity so that it can meet the demand and increase the pace of infrastructure development as required by client departments," unquote. As if we didn't already know. There it is plain and clear that the department does not have the capacity. How in the world would the department roll out the pie-in-the-sky plan for the legislature precinct? Never mind the Triple P arrangement. Do you truly believe that Public Works has the capacity to carry out its part in this arrangement? The Finance Committee certainly doesn't believe so. Now, this department not only has to deal with external issues, but also problems from other provincial departments who don't pay on time, like education, who, according to Public Works, is a bad payer. But then again, it's widely known Public Works has not maintained schools properly. Why is the health department establishing 3 clusters for its own maintenance? Perhaps they've lost confidence in Public Works. Even her sister department, Human Settlements, indicated their dissatisfaction with the quality of work done by Public Works and are delaying payment of millions. This is also what the Finance Portfolio Committee had to say about Public Works. I quote, "The Department of Public Works is further called on to avoid delays in issuing invoices to departments so that payments can be made on time," unquote. But according to Public Works, the challenges are due to client departments not paying on time. Is Public Works the real culprit now? What's going on here? Is it because the HOD is still acting or the MEC is missing in action? It's simply because everything the ANC touches fails. The opposite is true for the DA. Look at Amgeni. We are more than ready to govern this province and we are coming for your seats. Rosa 2024.
Thank you, Honorable Nair. Honorable members, let us move on. And our next speaker from the EFF, Honorable N.I. Mpaipeli, for 6 minutes.
Thank you, Chairperson. Greetings for the members. Siyinhlangano Economic Freedom Fighters KwaZulu-Natal. Siyasamukela isabelo zemali somnyango wezemisebenzi yomphakathi sonyaka ka-2023-2024. Nakuba kusikhathaza ukuthi kugcine sekuncishiswa izimali kuma-project athile, ekubeni lo mnyango unemisebenzi eminingi okufanele uyenze. Okufike kusikhathaze kakhulu ukuhluleka kwalo mnyango ekufakeni isitswebhu lapho khona kunezinsolo zomkhonyovu ezibandakanya izikhulu zalo mnyango osekuneminyaka kushaywa indiva. Kumanje kunezakhiwo zikahulumeni ezingakaze zilungiswe kabusha emva kokukhahlanyezwa izikhukhula nyakenye ngenxa yokuthi amathenda okuzilungisa ayenikezwa abangani noma abasebenzi balomnyango. Okubalwa nokunika izinkampani ezithile amathenda angaphezu kwa-1 million iyodwa. Nakuba umqondisi jikelele wezezimali ekuvezile ngokusobala embikweni wakhe ukuthi ngonyaka wezimali ka-2022-2023 lo mnyango awukwazanga ukusebenzisa izimali ngendlela njengokuba bekunuka inkohlakalo. Kuze kube yimanje akukho lapho umnyango usibikela ngezinyathelo ozithathile ukuqinisekisa ukuthi lapho ababandakanyeka khona emkhonyovini bayajeza. Kuyimanje iminyango eminingi kahulumeni eqashe amabhilidi kulo mnyango ithi ncinci kamjuli njengoba ikweleta lo mnyango izindodla zezimali. Kepha yazi ukuthi akukho ukulandelela okwenziwa yilo mnyango. Lokhu kukodwa okukhubaza lo mnyango ekuletheni intuthuko nezidingonqangi emphakathini. Kuyimanje kunezikolo ezikhahlanyezwa izikhukhula kepha ezingakalungiswa ngenxa yokuthi ngisho umnyango wezemfundo ukweleta lo mnyango izindodla zemali. Kumanje kunezikolo zasemsunduzi ezaba yizisulu zokucinyelwa ugesi ngenxa yokuthi lo mnyango ubukweleta umasipala wasemsunduzi ugesi. Yize sisamukela lesabelo zimali sika-2023-2024 siyafisa ukuba lo mnyango ushintshe ukwenza ngokulandelela lapho kunezinsolo zenkohlakalo khona, uphinde futhi uqhamuke namasu okuqoqa izimali kulo mahhovisi kahulumeni awukweletayo. Iqiniso lithi imali ikhona kulo mnyango kodwa ayisetshenziswa ngendlela. Okukhubaza intuthuko kugcine sekwenza nokuthi kuncishiswe isabelo zimali ekubeni kunemisebenzi eminingi yokunakekelwa kwamabhilidi nomhlaba lo mnyango obhekene nawo. Ngiyabonga kakhulu.
Siyabonga, Honorable Mpaipeli. Our next speaker of the NFP will be Honorable C.M. Shinga for 2 minutes.
10 minutes. Honorable Chair, honorable members. We are pleased to note that the department plans to complete major projects for the 2020-23, including capital infrastructure projects, such as the completion of new Ilembe district office, the completion of the refurbishment of existing building to convert it to the new KZN Entrepreneurial Center, renovations of the lecture hall facility in eThekwini region, as well as upgrading of an existing workshop in the Vryheid sub-district. However, the NFP is concerned that the carry-through effect of the MTEF budget reduction for 2021-2022 would cause the department to delay the completion of certain projects. We call on the department to ensure that some of these projects are completed in the 2023-2024 MTEF. The department received additional share funding of thank you, Chair. Share funding of 204.866 million and 6.760 million to alleviate the pressures against municipality property rates. However, the budget for property rates is low compared to what is needed to cover the shortfall in respect of municipal property rate. The NFP is concerned about the department's MTEF budget cutbacks against property rates which are not viable and will need to be reconsidered by the department. In terms of the EPWP responsibilities, the department aims to support all provincial departments and municipalities to achieve set targets, work opportunities and full-time equivalents, while the department only received 3.8 million in the EPWP grants. Thank
Honorable
you.
Shinga. Our next speaker of the ANC, Honorable E.V. Dube, for 9 minutes.
Ake ngiqale lapha ngibingelele bese ngisho ukuthi inkinga yenu nina opposition nifuna ukutshelwa konke. Ibudget ekade ifundwa la iyimpendulo yezinto ekade nizoyikhuluma la. Manje into enenzayo, you are speaking a lot of words full of anger bese ningazi ukuthi ekugcineni yini kahle kahle enizoyikhuluma la. Every time sihleli kuma committee meeting, these issues are raised and we try as much to discuss them together as a way forward. When you come here, you start to say things that should have been said there, and some of the things have been solved. One of the serious crises, ukuzofika la, ukhuluma imbudane yento ongeke uyiprove. Sizwa kuthiwa kulo mnyango, sizwa kuthiwa kulo mnyango, sizwa kuthiwa kulo mnyango. Mase kuthiwa prove ngeke ukuprove njalo ngoba izinkulumo la enekhuluma ematshwaleni. It is a, let me say this. Go on parliamentary loco. And
please proceed, Honorable Member.
Ngiyabonga. The ANC, the African National Congress, made a promise, a better life for all people. We are the government of the people, and we are the vehicle that is serving the people to make sure that a contract esayibhala nabantu iba impumelelo. Sometimes when you listen to Martin Luther King Jr. saying, I have a dream, some of the people like Honorable Ovela DA, Uvela Pupe, not understanding ukuthi Martin Luther King Jr. wayekhuluma nge-future. Le future esesikuyona indlela enikhuluma ngayo ibonisa ngokusobala ukuthi kusekude kakhulu ukuthi ninganikezwe ithuba lokuphatha umbuso ngoba enikwenza kakhulu isongiso nje lesenikhulumayo nizama ukuphindanisa amazwi kodwa kungaqhamuki lutho oluyisolution kini. Abanjani abantu abalwa nesolution yazo zonke izinto abanikezwa zona? Ngiyafisa ukuthi ngibonge kakhulu inkulumo enohlonze ekubeka ngokusobala ukuthi izinhlelo ezenziwayo lo mnyango zizosinika inqubekela phambili. Expanded Public Works Program, ake ngiyithinte nje ngidlule kuyo ngoba kwabanye abantu iyiphupho elibonakala ukuthi likude ukuthi lingaphumelela. But EPWP is one of government key programs that is aimed at providing alleviating poverty and making sure ukuthi abantu bakithi they get temporal work labo abangasebenzi. Now i-problem ke le when you are considering abantu abazothi ake ninikeze abantu bohlango oluthize ithuba nabo banikezwa bahluleka esikhundleni sokuthi baseve sonke bathatha ithuba lokuseva abantu abathize. And that is why we are standing here truly believing ukuthi African National Congress is the only vehicle that will make sure ukuthi ikhipha abantu ku-poverty esikuyona njengamanje. Unemployment is one of the most critical problems and angikhulumi ngayo, and we do not have a solution about it in our society today. Millions of people are poor and could not provide themselves. And that is where African National Congress comes in with the programs of EPWP. Kuningi kakhulu esihlale njengekomiti sakhuluma ngalolu hlelo. Kwabonakala ukuthi olunye lenhlelo ezicace bha ngokusobala ukuthi uDepartment of Public Works unomsebenzi omningi owenzayo ikakhulukazi ukufukula impilo zabantu. Ngiyonke ngiqoqele nje ukuthi enye izinto ebalekile empilweni ukuthi wazi ukuthi lokho esikwenzayo njengo-African National Congress asinakungabaza. We are very confident ukuthi lokho esikwenzayo kuyabonakala nabantu futhi bayakuthakasela. Ingakho ngaso sonke isikhathi nizonswini nizame ukuzenza laba bathi ayikhale kubona ukuthi niyazihemela nje anazi nokuthi sikhuluma ngani zizokhala kunina ngoba nina abantu enifanele ukuthi sikhale kini yini eniyenzile eningayiveza nithi nakhe sikwenzile. But we as the government of the ANC through this department we have not just shown, we have excelile according to the things that were stipulated this afternoon. Nihleli nilalele ukuthi nifuna ukutshelwa konke. One of the things enile nibuza ukuthi sizwile ukuthi uhulumeni uzokwenza 1 no 2 no 3 uzokwenza kanjani. Leave that to us. Leave that to us. We have been tried and we have been tested and we have proved to succeed. Ingakho nje mawuzoshaya igempe nakho ikole ezingaka asizazi ukuthi ziphi asabonakali ngoba ezinye nani zakhe ngemali enanithathe kubazali nakho ikole zodaka izindlu zodaka. Manje ke siyayitshintsha ke izindlu zodaka ke manje sinakhela izindlu
Honorable members who are still in the house. Honorable members,
government through this.
Let's keep our order, please.
Government has contributed towards the elimination of poverty and reducing inequality by creating employment through the EPWP. Ake nginikeze isibonelo. 25 new external students awarded bursaries for built environmental studies. Wena wafunda iBible study manje iyo unenkinga ukuthi mawuze la kina safunda theology wafunda iBible study yiko nje unenkinga lo nayo ukuthi abantu bavuka umoya. Sikhuluma nawe uvuka umoya. 50% women 50% of women have got a representation at the SMS level. 30% representative of youth in the staff complement. Wawukuzwaphi lokho? Ngoba ngesikhathi senu le naniqasha laba badala olundi singavunyelwa ukuthi abantu abasha naniqasha abantu abathi makukhulwa ngemsebenzi bathi la kujahweni fanele kwakhiwe izindlu la kujahweni. Manje sishahile-ke siyashesha ngoba kusebenza abantu abasha. No doubt that the EPWP is having a significant impact in the lives of participants and their families. 62% of all participants were unemployed and actively looking for work before participating in the EPWP projects. Wow! You should be clapping hands. Kodwa ngizolumbuza kujahweni. Let me tell you ukuthi sijaheni. Sijaha ukuthi impilo zabantu siguqule. Sijaha ukuthi abantwana bethu bathola imisebenzi ehloniphekile. Sijaha ukuthi si develop ama skills abantu abasha. This department has 39 students studying towards degrees, as I've said, in the built environment. In the current year, 2023, 17 students who benefited from the bursary program graduated in 2022. Nina nonkombi ikole zodaka. Thina sikhuluma ngabantu abaphasa manje. The professional disciplines, sikhuluma ngalo mnyango njalo. The professional disciplines include mechanical, electrical, and civil engineering, quantity surveyors, architect, construction project management, and property valuation. Buzanike kuzokwenzeka kanjani? This is where it is going to happen. La sakha khona abafundi abazokwazi ukuthi mabephuma lapha esikoleni bangene emkhakheni ukuthi bakhe badevelop izwe lethu, imisebenzi iqhamuke, impilo engcono ibe khona. That is why abantu bezovotela uANC ngo2024. Nizosala la nihleli khona. Futhi abanye benu bengiya ngesikhuta ngiyabonga. Honorable Dube.
We have received an apology. We have received an apology from Honorable Takur Rashpansi. Therefore, we'll move to Honorable M.E. Pagati for 2 minutes of ATM.
Honorable Chairperson, let me take these 2 minutes and address some confusion here. I must place it on record, Honorable Chairperson, that the ATM does hold the executive accountable. And everyone that knows that in our portfolio committees where we are, we raise issues sharply. It's just that we don't play politics of ground standing, Honorable Chairperson. So people must not be confused. We are here to pass the budget so that in so we are not here. He knows exactly that when there are issues, we raise them sharply. Baba Chunda, asenze sure ukuthi abantu baqashwa abamnyama baqashwe, asenze sure ukuthi abantu abatrainwe bathole izertificate bathole izertificate wakuthiwa ngeke sizithole sabantu abamnyama. Asenze sure ukuthi we produce ama-millionaires, abantu abamnyama, ikuze kuphele lento ukuthi umuntu omnyama kuthiwa uyimillionaire noma ukuthi uyibillionaire untshontshe somewhere. Ayenzeke leyo nto. We support the budget. Thank you.
Thank you, Honorable Pagati. Our next Honorable Speaker will be from the ACDP, Honorable S.E. Mangele for 2 minutes.
Chairperson and MEC, all my colleagues, ACDP notes and accept the budget. But Chair, the issue of these old buildings, which are all around, some of these buildings are used by thugs to hike and perform illegal activities. So as ACDP, we suggest that they should be removed or transferred to the municipalities or other be demolished. Because ibona benza ukuthi i-department igcine inama-rates amaningi engawakho. Bese isiba nobutha nomasipala, at the same time uthola ukuthi awasetshenziswa ngendlela efanele. Sinota siyajabulela indaba yama-bursaries MEC, sengathi engaqhubeka njalo nama-skills development, konke lokhu esikubona laphaya kuhle. Kodwa sengathi ngelinye ilanga nje ungake wakhe nje amasonto ebemabili nje. Ebemabili nje. Ukubonga uNkulunkulu iability nokuhlakana kunikeza khona ukwenza lo msebenzi. God bless you, MEC.
Thank you, Honorable Manele. And our next honorable member from the ANC, Honorable SGS Mavimbela, for 10 minutes.
Thank you very much, Chairperson of the session. Greetings to the Chairperson of the African National Congress, the Treasurer of the African National Congress, the honorable members of the August House, and also the officials from the department. Let me start by appreciating the truth that was presented by Honorable Madlopa. Kuyashithi siqhamuka ngandawonye, Honorable Madlopa, ukukhumbuza lokhu kuhlanganyela kwethu kwanamhlanje ukuthi inkatha yenkululeko yesizwe yabunjwa yasungulwa ngabaholi bokuqala bakaKhongolose. Noma-ke mhlambe kwahamba endleleni kwaba khona la okulahleka khona, kodwa iqiniso uyalazi futhi iqiniso liyohlala limile ukuthi kwakumelweni ngenkathi kukhandwa inkatha yenkululeko yesizwe, not a political party. Ngiyafisa-ke ukuthi ngingakaqali ukuxoxa lolu daba engizoluxoxa ngoba it will be educative in some of the honorable members that they were presenting their budget speech. It's unfortunate that honorable members came prepared without even trying to listen to the honorable MEC when he is presenting his budget speech here. Kodwa ngiyafisa ukusho ukuthi the 5,125 targets that was made by the department and ukwehla kwawo ngeke phela kuqhubeke kodwa sibe sivumelana ukuthi imali ziyehla, ama-budget cuts affecta wonke ama-departments kahulumeni. Ngakho-ke there are no miracles that MEC angawenza ukuthi ama-budget cuts angabibikho. Ngiyafisa-ke uku-emphasize ngiqala udaba lwami ukuthi u-public works is the implementer of choice. So uma kuthi anikukhumbuli lokho ngicela nikukhumbule. Kodwa before I start my debate, let me assist Honorable Ne. Indeed, this department is having capable officials led by the MEC. And if this department is led by capable officials, led by the trusted MEC, which is deployed by the African National Congress, indeed, uyobona-ke some government departments, even from other provinces, coming and benchmarking in KwaZulu-Natal and taking employees from KwaZulu-Natal. The likes of Mdadane are now in Gauteng province because we are excelling as the province of KwaZulu-Natal. So okay, you must be proud and you need to appreciate that. And what I love the most about us as the African National Congress, where there are failures, we'll indicate where we do have failures and also indicate where we have our successes. Let me help you because into a property rate, which is glaring. Honorable members, as the African National Congress in KwaZulu-Natal, we welcome the budget which was presented by the MEC for the Public Works, Dr. Ntuthuko abamjwayele bambiza ngoJunda Mahlaba, the Treasurer of the African National Congress. This department, amongst many areas, deals with a sustainable infrastructure development and property management in the province. As the custodian of all provincial properties and payment of rates, this department has a critical responsibility of managing its budget to ensure all of this is done smoothly. With that said, we note the budget constraint that this department faces, especially with dealing with the property rates. We are all aware of the tough economic pressures faced by our economy. Unfortunately, the Department of Public Works has not been spared, as each year it faces higher than anticipated property rates each year from municipalities and government departments. It must be mentioned that Department of Public Works do attempt to lodge objections where it is viewed that the increase in property values is high. But it must be known that the response from the municipalities is at a snail pace, resulting with the department being obliged to pay at a high value while waiting for the outcome of the lodge objections. That's why I'm saying I'm educating you, because you do not learn, you do not do investigation when you come to present your budget speech here. We also welcome the interventions by the department as they play an active role in negotiating in the bid to reduce the property rates spending pressures. Through this intervention and negotiation, municipalities get incentives in terms of the percentage discount in rebates. As stated in the manifesto of the African National Congress, ours is to ensure that we continue building a capable state with a government that accounts to the people and responds to their needs. Since the advent of democracy, the ANC has made great progress in meeting people's basic needs and improving the provision of education, healthcare, and other services like electricity and water. We have done much transform local government and build better communities. As a province which grapples with triple challenges of poverty, inequalities, and unemployment, which also comprises of rural areas. Ours is to ensure that we work together as all spheres of government through the district development model to work with municipalities to tackle the issues of property rates. If these rates are not paid, it is the masses who rely on us who will suffer the most. This is why this government has made it a priority to tackle this matter. We welcome the work that has been done to negotiate with the municipalities to ensure that the public buildings such as our schools get basic services. So we appreciate the strides done to negotiate with one of the big municipalities, including smaller municipalities who have been working with the department to manage the shortfall in the budget. Honorable members, we cannot ignore the fact that there are instances where invoices received contain incorrect information, such as information of the municipality valuation roll not agreeing with the information on the invoice. So you cannot pay the invoice when those things are not tallying. So we note the intervention done by the department to engage municipalities to rectify this as it caused delay in the processing of payments. In respect of the 2022-2023 financial year, Honorable Chairperson, the Department of Public Works equitable share allocation was 935,939,000. As the African National Congress, we appreciate the intervention by the Provincial Treasurer, which managed to provide an additional budget of 100 million to enable public works to honor some of the invoices received for the past financial year. Even though we welcome the intervention by Provincial Treasurer, there is still a shortfall of about 80 million worth of invoices still to be paid for the previous financial year. Further cuts in the budget, it means that in the next financial year, this gap will continue to grow. We have noted the request by the MEC that for the Department of Public Works to comfortably ensure that full settlement of all rates debt owed to municipality in KwaZulu-Natal is paid. The equitable share allocation requires an increase between 10 to 12% annually. As the progressive organization in KwaZulu-Natal, we welcome the intervention made by the MEC, Dr. Mahlaba, and the head of department for the manner they have managed this thorny issue. In reality, in this matter of property rates was not dealt with adequately. We could have been dealing with a bigger crisis in our province. As the African National Congress, we resolve to strengthen the political and administrative institution to deliver on its mandate. These include building effective integrated planning and service delivery services. With almost 30 years into democracy, these are the changes we look forward to seeing improving the lives of our citizens. Guided by the Freedom Charter, ensuring everyone gets basic services. It's one of the fundamental principles of the ruling party. As the African National Congress, we support this budget, Honorable Chairperson, and the African National Congress will be in this house in 2014, also sitting on the right. Thank you very much, Chairperson.
Thank you, Honorable Vimbela, right on time. Honorable MEC Mashaba, for 20 minutes, the response by our Honorable MEC for 20 minutes.
Usihlalo ngaphuthi akazi ukuthi nithi alibonge makusukuma mina. Sibingelele sihlalo. Ngiyele futhi ku-leader of government business. Usihlalo weyihlalo. Nomsomlomo sekhona yini. Sibingelele kusihlalo we-portfolio, ku-chief whip Phatshwa, amalunga ahloniphekile ePhalamende wonke. 20 minutes uzoba mningi. Uzoba mfishane. Ya ngithatha isikhathi esincane ngoba beningasho lutho benithule. Angithi hayi uzamile. Uzamile uwedwa. Ya uzamile. Angiqale lapha ku Honorable Naya, when she said, Naya, I'm attributing successes to the ANC. Whenever you speak, you talk about Western Cape and you say, look at what the DA has done. I will never stop doing that. But it's fine. You will never win KZN as well. Sometimes you see it's disappointing when people are sitting at home and thinking about members of parliament or provincial legislature. They don't think we can think so shallow. Sometimes we think very shallow. And we talk about, we don't run government through tabloids. You talk about things which have empirical evidence. I just wanted to emphasize that I'm not going to stop talking about the ANC because I'm ANC. I know nothing other than the ANC. Nabe-IFP mabefika bashilo ukuthi hayi cha nami ngiyinkatha. Ngakhuliswa indoda ngiyinkatha. Manje nami ngeke ngiyeke ukuthi ngiyi-ANC ngikhuliswe i-ANC. Yangagcina nje ukungikhulisa ngisa ngisho esikoleni yikho ngudokotela. Nginopolisi so ngizokhuluma ngayo. Indaba ye-budget, I think we must, Chief Whip, try at some point to organize a workshop for MPLs on how UDORA works. Because they think you just decide to wake up and say, no, I need 10 billion and then 10 billion is here. This is not a supermarket. This is government. There is a difference between the supermarket and spaza. When you try to pass. Noma uvuke lapho ubamba isikaphu uyodayisa isikaphu. Uthatha imali yesikaphu uyifake la ephaketheni ngemumva uyabuya ntambama isaphelele. Nginazo wena Debula mhlawumbe ngineziningi kunawe futhi. Indaba yama-buildings, honorable members, especially around Ulundi, we've been discussing it with Mr. Majola. We are dealing with that matter and we'll deal with it decisively. Because we can't have people who are occupying government buildings illegally. And once we deal with it, asifuni kubuyela sekuthiwa kwakuhlukunyezwa abantu bekhishwe endlini. They are there illegally. Bekusho nina on record. We will be dealing with that. Well, ngeke vele kuzoba next time ngeke kube manje angithi basila. Yikho umthombe nathi sometimes i-common sense into engasebenzi ngoba when uzama ukusebenzisa i-common sense manje i-common sense ayisebenzi la. Bayade bhuye kusafuna ngihambe nawe nje ngikuhlalisela ngemumva evenini senawe lapha ekhaya. Ngifike ngifundise kahle ukuthi izinto zenziwa kanye ngoba hayi uneminyaka emingaki. Kusafuneka ngimfundise ngempela. So siyadiyana yena ngizokubeka nebhulibhuli yami la ngemumva uhlale nayo la. Le ndlela enanitreat-a ngayo omkhulu bethu. Uzoku-interpretela umama la wena Debho iy'nsizwa ziyangcweka. We are not fighting a man, siyangcweka yabo. Ungaphatheki kabi ungazohamba ekhaya ufike lapho uphuze ya clip rift yakho uyishaye. Uzofika uDubula ehedi iy'nsuku lezi zomhlukumeza afike ashaye i-clip rift yakhe lapha. Awubuye kusasa uwe France oshaya izameleke. But on a serious note, we'll be attending to this. It is a myth now that the MEC is missing. I even spoke to Rogers. I said I missed one meeting. You decided to write that I'm missing. I was even in the hospital. You should have asked. But the problem, you want to sensationalize things even which are not necessary. It's like the letter that you wrote about Chatsworth houses, the plan that houses are going to build, the communities complaining. You are part of those people who are promoting racial segregation. Because you are part of those people who are saying, not in my backyard. If we find a site there we are going to build, we are not going to apologize. We don't need to ask anyone. If we find a site there, we are going to build there. If it's human settlements, we are going to go and build there. Number two, we are, as Honorable Mavimbela was saying, the decrease in the number of people who can be employed depends on the budget. If the budget decreases, the number will decrease. Because we are not running a spaza shop here. La khona umshana wakhe angafika nje athatha ama-choice asothetha aphume nawe engawakhokhelanga ahambe bese kuthiwa hayi isitoro sikamalume. We are running government.
Honorable Chair.
Honorable Tuma.
Rule 52 on a point of order. I'm sure you've persevered enough for Honorable Tipur. You spoke about it when it started. He's still persistently disturbing the MEC on the podium. Each time when you speak, there is a decorum. There's no one to disturb him. Something got to be done. This is not his house. This is an august house which does not belong to him alone, but belongs to all members. We deserve some understanding that as members, we should be respected. And please do something.
Thanks, Honorable Tuma. I think I've said this when we first started the session. And I've also noticed it from the word go. It's not just because of the session. It's been happening even yesterday. I want to plead with Honorable Member Tipur again. I've also noticed it. Your language seems to be very loose. We are in the house. We might see us as the people that you might dislike, but we are not here for you. For you, it's just to respect the house, not us maybe. So I'm just pleading with you once more. Let's all members respect the house, your beliefs and whatever that you want to do. You can still do whatever that you want to do outside. But I'm just pleading with you once more. We just left with a few minutes. But please, it actually pushes the discipline of this house and the people that are here. What is it they are learning from us? So I'm just pleading with you once more. Let's try and behave. This is the house that needs a lot of all of us to be disciplined. So I'm just pleading with you once more. Thank you. Honorable Matlaba, you can proceed. Thank you.
Order, Chair.
Okay. Yes.
Chairperson, I'm writing on Rule 57. Point of order 57(1)(a). Firstly, the Honorable Duma rose in the wrong rule. Rule 52 deals with the presiding officer's prerogative of the House with regard to adjournment and with regards to suspending the House. It has nothing to do with the order that was raised. Also, Chairperson, you are applying double standards. You allow the member at the podium to turn the House into a circus by the language that he was using, and then you reprimand the member from the DA for heckling, which is a precedent in this House. Heckling is allowed to a certain
Honorable Kika, can we then check on the rules?
Yeah.
And then we will just then come back to you.
Thank
Can
you
we
very
do that?
much.
Thank you.
Rule on it.
Honorable Mashaba, you can proceed. Thank you.
Thank you very much, Chair.
Wrong rule.
In terms of, as I was saying, what Honorable Mavimbela was saying, let me repeat this. We are in constant contact with National Department to see how they can assist us in terms of increasing the money. We've engaged with Minister Zigalala. He's positive about it. We are waiting to finalize the negotiations. because we need to create more jobs. Our people out there need jobs. They don't need all the seekers, but they need jobs. To us, maybe the amount that they are earning might be little, but to a person, you must take your time. Dr. Kika, as you stay in Newcastle, sometimes take your time. Drive through Ngakane Bridge, not the new one, through section 1 up to section 7. During the week, on a Tuesday, you'll see how our people are. When they sit and move around the house with the sun, you'll see how poverty has affected our people. This, to some of them, when they get it, it's a real job. It's a serious job. That is why this government, we are prioritizing it, and we are saying we will make sure that we try and find funds to increase the numbers that we can absorb into the system. The issue of the upper toe, ngiyafisa ukuthi usazise ukuthi kuphi sizokwenza ithuba majola asiyattendeni so that sizobona ukuthi si-attenda kanjani indaba yakhona, because ngeke sibe nento eyi-white elephant sakhe into ihlale ingasebenzi. Kodwa nawo ama-abattoir afuna uwakhe endaweni ila azosebenza khona, ngoba ikhona yake yakhiwa ngapha. Angisho ukuthi ngeke isebenze ngale ngwavuma, kodwa ifuna uyakhe endaweni la okuzoba easy khona for i-market. Ngeke nje ngithathe i-abattoir ngiyoyakha lapha ngakithi enkande, ngeke isebenze. Ngisho sengithanda. Dinga indawo la khona okuzoba ney'nkomo eduze. Hayi, indawo engakini ayinazo iy'nkomo kahle lezi ama-abattoir. Hhayi, angithi ngiyazi, nathi siyayihamba lezi ndawo siyazi. Futhi sifulphela inkomo, mama, akusiyo inkomo ngoba kuthiwa ngiyeke ngibone thina abantu ikakhulu abampisholo safundisa ukuthi uma ufuya inkomo ufuna ufuya amanguni noma yiphi inkomo kuthiwa iney'mpondo, hhayi iney'mpondo. Akusiyo nkomo leyo, into engekho leyo. Kuthiwa imisile, into engekho leyo, ngeke kusize ngalutho. Buza ukuthi yikhona yini iy'nkomo. Ngizokukhombisa lapha efonini yami ukuthi inkomo into enjani. Mase ngithatha inamba yakho sesizokhuluma ngendaba ye-abattoir. Sengihlala phansi ngoba ngithe angizukuthatha isikhathi eside. Uqinisile honorable, ubeqinisile honorable phakathi. Kubele sakhe imisebenzi kuqashwa abantu bakithi. Mina ngeke ngiqamba amanga, kufanele kuqashwe kakhulu abantu abamnyama. Ngoba bazalwa kungenalutho ekhaya. Khona abazalwa vele sebekelwe into. Khona sasifunda nabo nje, wathi ephuma esikoleni ekhaya kuba wayeseneflat enemoto. Wena uyoqala uya lapha, awunazo ngisho iy'cathulo. Uyobheka ama-patient lapha uyabona nje ukuthi bayakubuka nje ukuthi uyadlala lo. Yabo. So kubalulekile ukuthi imisebenzi yakhiwe. Skills development, babumanqele, it's something that we are taking very serious as a department. Having said that, I think I've covered a lot. Obekubalulekile ngoba lokho okunye cha, angizwanga mina ukuthi bekuthiwani. Angifuni ukuqamba amanga. Abanye bebekhuluma nje ngoba kufanele kuthiwa kakhulume, kodwa angizwanga ukuthi bekuthiwani. Siyabonga kakhulu. Thank you.
Thank you. Thank you, Honorable Mahlaba. on announcements. Firstly, let's appreciate the debate today. We have come to the end of our debate on vote 14 and also to the end of business of the day. But I must also thank you, honorable members, for your patience and dedication to your task given to all of you as by abantu KwaZulu-Natal. uNkulunkulu babamkhulu makanisikelele. Our announcement tomorrow. It's Thursday. We are starting at 9. We wish members to be seated at least by 8:45. Thank you. Nambe kahle, siyabonga.